Okay, call the meeting of the Carroll County Board of Commissioners to order for 10/26/2016. Pledge allegiance to the flag.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The motion to approve the minutes of last week.
I'll make a motion and we approve the minutes of
October 21st.
okay, we got, and they're all set. Oh, yeah, here they are now. They're attached. Of October 21st, 2016. And
So I hear a motion to second it.
Second.
Any further discussion?
I don't see any corrections, so
All those in favor of the motion say aye.
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 Aye, and so voted. Need to borrow your pen. Public input? No public input? Update on the fiddler contract?
I believe you all have a copy of the revised contract. I've changed the date to reflect today's date and changed one sentence on Schedule D. Other than that, it's the same as previously submitted and as approved by the county attorney, Sandra Cabrera.
She's not the county attorney.
Well, the attorney who
Oh, the
was hired
county.
by the county to review the contract. As
And
you-
where is your correction?
On Schedule D, which
D as
is
in boy or D as in
D
boy?
as in dog, 13 of 16.
Okay, that's what we need. 13 and 16. Okay, go ahead, Lisa.
Paragraph 4, it was a rewording of the third sentence. Didn't change the content, it clarified it.
Is that including all use hardware? Is that the one?
The whole contract includes.
This agreement may be voided by either party upon the occurrence of major
Next
events,
paragraph down.
strikes. That's the one that you had concern with last week.
Right.
And this doesn't include any provision for automatic renewal?
It was taken out, the original did, I took it out.
But this is for how long?
5 years.
5 years.
It's a fixed price for 5 years.
And is there any, you said it was a fixed price and there's no escalation clauses anywhere for changes in cost to the company?
If you look at page 8 of 16, it shows the cost per year, per month, $6,525 per month. And that is based on a docket count number of 14,000. The contracts previously were based on a docket count of 18,000.
Right.
And we're guesstimating that number. If the docket count does go above 14,000, there will be a per docket cost. I don't anticipate that to happen next year. We'll be able to adjust that in the budget if it does happen for the next year, if the economy soars. It has been over 18,000 in the past, but that was way back at the 2006 timeframe when everything was really
Staying
high.
on the same subject, you've got page 14 of 16, look at the top. So the client understands that access fees for Tapestry may change, but the above noted proportional revenue share remains the same.
That's Tapestry, which is
May
the,
change without notice.
that is one service that's offered by the website for people who want to go on and purchase a copy and they don't have an account. They can put their credit card information in. And what happens there is if, right now it's $5.95 per search plus a fee for the copies. If they at some point in time, which they're not anticipating doing, change that price, which is charged directly away from us to the client.
It's the end user.
It's the end user, then we would still retain this proportionate share of the income. So this is not a cost to us.
Right, our cost wouldn't go up. It would be their cost.
It would be their cost, and it would be a benefit for our income if they raise the price, but I don't anticipate them doing that.
Go ahead, you had a question?
Lisa, I guess I didn't get it. You said it's based on 1,400 documents
$1,000
a year.
a year.
Okay.
Last year,
And what happens if we go over that 4,000?
if we go over the
14,000.
14,000, it's $4.05 per docket, additional cost.
And what happens if we go under?
If
Nothing?
we go under,
We're paying a set fee, so if it goes under,
yes, and it won't go under much, if anything. Last year, we did 13,036 dockets. This year, I think we're on track for more than that, but nowhere near 14,000.
13,000 what?
36.
13036.
Any further questions? No? Do I hear a motion?
I'd like to move that the board accepts the contract with Fiddler for a computer system and software license sales agreement to be administered by the Register of Deeds office. That presented to us today. Doesn't really have version 3.1.7 as noted.
Do I hear a second?
Second.
Any further discussion? I'm going to be signing this on behalf of the motion. As chairman. All those in support of the motion say aye.
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 And so voted.
Thank you very much.
Page 11, 12, 14, and 16. You have to sign 4 places. Did it? Great.
Thank you.
You want me to sign another copy?
One more page.
Should that be in again?
Get you copy.
Should that be just the registry of deeds?
Yeah, I mean, I don't have a problem with that. I mean, it's really, her office, so.
Next.
Thank you, Mr. Chairman. I'd like to move down to the emergency trailer discussion. 2 weeks ago, we had Jessica Rosman here from the Emergency Management, and you had asked her to get some verbiage and wordings of other municipalities that are in the other regions. And in your packet is a complete packet. I believe there's 27 pages. Cheshire County does have an agreement. I don't know if it's Cheshire County or it looks like it's Cheshire Medical Center. Yeah, it's the city of Keene actually. It's not Cheshire County. So in Carroll, it looks like in Cheshire County, they're purchased by the county because they're the fiscal agent. So that's totally different than what we're doing. And they're kept by the city of Keene. North Country Public Health Consortium. They have 3 trailers. There's one in the town of Colebrook, registered and insured by Colebrook, Errol, and Haverhill, New Hampshire. And there's an MOU with all of those. Those 3 agencies. Another one is the city of Nashua, which is insured by the city of Nashua. Sullivan County, trailers are registered and insured by Sullivan County. One is stored in a barn. They have an MOU. And the Seacoast County Public Health is at Lamprey Healthcare, registered and insured by Exeter and Portsmouth Fire Departments. So it looks like it's just Sullivan that has this unique relationship. So Sullivan County will use their vehicles to tow it to the trailer location at the time of the emergency. So that's another different circumstances than we would be getting into.
Somewhere I read in here where the county is the sponsor of the coalition.
That is in, I think it's Cheshire County.
Where we are not.
Right. Now, when our trailers were purchased, they were purchased by the county since they are our fiscal agent. So the county actually bought the vehicle, they actually bought the trailers. I spoke with the Primex yesterday, had a lengthy conversation with them. Unfortunately, the county, if we were to have the custody, the care, and the control over the trailers, the county would be responsible for those trailers, for the roadworthiness, for anything that happens to those trailers. And so with that information, I am not recommending doing this. One is, we didn't buy the trailers, they're not our trailers. So they're asking us to register them, insure them, which would raise our rates. And any incident would also raise our rates as well. It puts a little more burden onto the county taxpayer. It requires us to maintain the vehicles roadworthy. So the bearings, the tire pressure of the tires. We have to have they have to have the trailers inspected as well. So if we needed to repair something on the vehicle, we'd have to pay for that as well.
Commissioner Babson.
Yeah, how much is the increase in our insurance if we,
She didn't give me a dollar amount. She said that because of the use of the trailer, it would affect it aggregately.
So it'd be under a blanket policy.
It would, but it would increase our rate next year because of what it's being used for. They have to take that into consideration as well.
On the other hand, it probably sits there all year long and not being used at all.
I've never seen it move, and I've been here a year and a half.
Yeah. The only time it's moved is when it was moved was because of plowing, snow plowing. It was in the way at one time.
So there will be a cost associated with this, and Primex is recommending that we get an MOU with every town that will use those trailers. So that's why I'm saying, they should do it themselves. They should keep it to themselves.
Go ahead, Commissioner Babson.
I'm not gonna support this unless we get a letter from the people that own the trailer and indemnify us from A to Z, so that there's absolutely no risk to the county taxpayer. I vote for it, otherwise I'm voting no.
So all you are willing to do is to leave the trailers on our property,
Yes, as long as we don't have
Plus-
any liability.
plus no liability in case the plow truck plows into one or somebody backs into it.
Or
We're
the
not
fire
responsible.
department takes it and rolls it over and hits somebody, anything.
Unfortunately, if we hit the trailer, it's on our dime
Yeah,
because it's our fault. We hit it. I
yeah.
mean, it's right there. It was just careless.
That's almost acceptable, except that once it leaves this property, or somebody's injured while they're picking it up, I don't want the county taxpayer to be responsible.
So, just for an example, there's an emergency in Wakefield. Wakefield comes up, grabs the trailer. We failed to properly maintain a wheel bearing. As they're pulling the trailer down the road, the wheel falls off, bounces in someone's windshield, and they drive off the road. It may be an exaggerated example, but it is an example. It's happened. That's something that because we had custody care and control over that vehicle, we failed to replace that bearing or failed to check the lug nuts. We may be on the hook for all that damage. So I don't know, this is kind of a unique relationship. Someone asking us to take the trailers. They're not our property, but yet to
I
inspect
wonder
them.
why they don't have it housed at their office, at the Hudson building here in Ossipee, rather than have us have it on our property.
Mhm.
At the time when I was on it, I agreed to put it on our property. However, at that time, they were moving from one office to another, and they were not sure where they were going to be. And the outfit was pretty well not organized as well. Now apparently they are. So You want to make a comment before we make a motion?
I just have another question after you're done, before we go to the motion.
Well, yeah, this packet of information is a lot of information, but doesn't seem to necessarily apply to this situation.
Right.
I think for this to work, we would need the memorandum of understandings from all the towns. Those, I believe that the coalition said they already had memorandums of understandings with all the towns. So we would just need to be included as part of that memorandum of understanding. They need to present to us what they have, and I agree that, we should be indemnified and they should be responsible for the care of them. That's where it gets a little more dicey, is the insuring of them and maintaining them. However, having said all that, what benefit does it have to the people of Carroll County, and to what end should we take that limited risk, and then in association with that, what would we do to minimize that risk? What, as you said, what is it going to cost for us to insure it, and what is the benefit to the county taxpayer? And that's where it comes down to me, and it doesn't seem like we have necessarily all that information. So I think we should let them know that if we are going to move forward, that we will need to see their memorandums of understanding with all the towns, and that we are included in that, and we are indemnified to the same levels as that their association is.
And what the
Then find
increase in insurance would
Yeah,
cost.
find out what it's going to cost, and find out if the expectation is that we're going to maintain them, and if there is any damage, not necessarily damage, if there's wear and tear, the wheel bearings need to be repacked or whatever, just from sitting there, that the maintenance thing, I should say, the maintenance of the trailers, if that's going to be our responsibility, how are they going to reimburse the county?
There is a benefit to the taxpayers in the county to have those in existence in case there is an emergency. So it's that outweighs what we have to do to provide that. I think we could store it here, but somebody else needs to be responsible for the maintenance and the licensing and insurance.
If we were to register these trailers, technically, wouldn't that make us the owner?
No, because you can lease a vehicle and it's registered in your name and the lessor.
So if we were gonna, because
The leasing.
registering these two trailers, I think it's about $7.50.
$16 a piece, for both of them aggregate. $8 for the plates.
That's peanuts when
Yep.
it comes to what they could provide, but I just want to make sure if we register for them and have them sitting here, that somehow, with a good lawyer, means that we own them or they're ours, and now we're on the hook. So I think Chris is right, we should see the memorandums with the towns, we should get the cost of insurance, or what the projected increase in cost would be. Frankly, for the amount of time they use, I can't believe the cost is anything but slight. You never know.
So I've got two things. So when the state, incorporated these districts or, these public health regions, they get grants for all the operations and everything else. So why is it that if the state's paying for this grants, why is it we have to do all this? Because they get money from the state to operate these public health networks.
Yep.
So that's one thing. Two, if they want us to take over the insurance of it, so now they don't have the policy on them, we do. How can they indemnify us if we are the policyholders? I mean, what is their backing? How do they indemnify us? So if we get sued, they're gonna take it? But they don't have insurance, because we have insurance on it.
Well, I would assume, Kenny, the insurance would be just as if, I think David said we drive in it while we're snow plowing.
No, I'm talking about the wheel bearing and a tire falls off and it kills somebody in
That
another
would be,
vehicle.
I would assume that would come under, if the insurance policy, if it's in our insurance policy, we'd be liable, but the insurance company, I hope it's big enough to cover it, whether it comes off a emergency trailer or it comes off of a hay truck delivering it.
No, but we're getting charged for it. If they're gonna indemnify us, how do they indemnify us? With what? If they don't have any insurance on these things?
What I'm saying is, if we find out that the insurance increase is only $20 a year,
Mhm.
and we're gonna be covered to $40 million or whatever it is,
I think it's 3 million, but.
3 million, then we really don't need to be as rigid on who's responsible if Primex will cover us for a reasonable rate. But if they don't, then we're hanging right out there for all of it. And that's where we need to be indemnified if they're not gonna.
But in the state of New Hampshire, the counties are maxed at $275,000 in a lawsuit. So,
Sure.
yeah, that's all that they can get from the county. So if it's 3 million, there's gotta be another.
I didn't know that.
Mhm.
That makes a whole.
Other
that makes a big
than
difference.
an employment issue. Employment can be anything,
Okay,
but a lawsuit's maxed at 275.
really,
Mm-hmm. Yeah.
that makes a whole difference.
So, my question is, we don't own the trailers, but we're responsible for these trailers. So then, so can they sue the owners of the trailers, who now don't have insurance on them? It's just, I'm wondering why they just don't take them. Why are they asking us to take over all of this? I don't understand it. If it's $60 for them to insure it, I mean to register them.
I don't think you got full disclosure.
No, it seems to me there's something more than this simple, oh, we're gonna keep them here, and there's something, I don't understand.
Well, I don't,
There's just too many questions.
there's too many questions, but I don't want to have them believe that we're throwing up roadblocks to not allow them to have them here. On the other hand, we have to look out for the taxpayers in the county.
Well, this is a unique,
Yeah.
this is a unique situation, where some were a pub, are they private, public, what are they? Probably public, I don't know what they are. They're a 501c3, they're 501c3, they're asking the government to take it over for them, but they still own them.
I think
They got them from a grant.
Yeah, so
I think
maybe we do need
the
more.
alternative, there's another option, and that is they could house those two trailers at their facility.
Or maybe
They're located
Wakefield
here
or
in the
Ossipee.
Hudson building in Ossipee. They could be parked there and take it off any of the liability of the county.
I mean, it's just not counties. In here you see, Hanover, Keene, Colebrook, Haverhill. These are all towns that are doing this. So
Yeah.
why is it that the county should do it? That's my question. Nashua.
In Nashua, is that for the entire county? Or does Nashua become the owner and?
To the city of Nashua, the 2 trails are registered and insured by the city of Nashua.
Right, I saw that. My question is it exclusively for the use of Nashua now?
They
Or
are the
is it
fiscal
for the
agent
county?
too. I'm sure it's Nashua Public Health Region, so it's for the.
Region.
Yeah, for the region. But they're also the fiscal agent too. So they're the same as Cheshire County. They're also the fiscal agent.
Well, I think that there are a lot of counties throughout the country that are responsible for emergency preparations.
But those counties also run everything.
That's
The
right.
highways, the bridges, the water, the sewer,
Yeah.
the roads,
Yeah,
law enforcement.
they have their own, in this particular case in Carroll County, they have their own board of directors.
Yeah.
Um, We have representation on it.
Who is it?
Santuccio out of the Sheriff's Department.
That's right. He's on the
And we
emergency
have
preparedness.
those things up there in the ceiling
Mhm.
so that they could use this as an emergency room, headquarters. I just don't know how everything, and it probably doesn't affect the trailers, but how everything is tied together. If there's an emergency in one town, do we open up this center? Do they open up this center and control everything from here, or do they go to the town? The town's gonna wanna have control over their own emergency, I would
Incident,
think. They need assistance, yes, they could call on them to do that, but
So is it that we need more answers to some questions? Do we need to get her back here before we make any decisions?
is that the feeling of the board?
I,
Or do we just want to say, we'd rather have them handle it and not involve us at all?
I think we have them come, and her come back next week, or can come back next week and tell us what the increase in insurance from Primex would be. And if there is any way that we can be completely indemnified in case of a problem. Other than that, I'm voting.
Chris, how do you feel? You want them to come back next week?
Yes, I mean, I think that there's reasonable reason for us to allow them, to keep them here, and for us to be able to have them inspected to the extent of their inspections, and that they're maintained to the level that they are inspected. I think that if the vehicle's inspected properly, and we have that done on time and as needed, then that would certainly go a long way as to our not maintaining the vehicle. I mean, if it's been inspected, we took it to an inspector. So I think that'll be helpful. So that, there are interesting questions. I mean, however, though, because when I think of, that perhaps a town that is already maintaining trailers and has a fleet, that they may be easier for them to do this. Because I think what they need is somebody who's available 24/7 for the fact that when it's time to get them, they're not at some office that only really runs Monday through Friday. That doesn't have somebody that can get there. I mean, presumably we always have somebody here, under any circumstance, that could get to them and let them take them, So that's,
What's to say that somebody couldn't come in and hook up to one of those trailers and take off with it in the middle of the night? They're not secure, I don't believe.
I don't think so. I mean,
They're
they're
not
out
chained
running,
together.
running.
Who's got the key?
Are they chained?
I don't know.
I mean, they're
I
sitting out
don't
there.
think so, but I could be wrong.
No, they just parked there.
They got Will coming in in a little while. Maybe he can
Okay.
tell us some more information.
Okay, we'll bring it up then. And maybe what we'll have to do is have them come back next week. Okay?
We really gotta get on this, on the smoking policy. So in the packet is the smoking policy. Do you wanna work on it a little bit?
Is somebody gonna find out what some of the alternatives in helping people get off smoking?
Wynnette's already done that.
And how is that gonna be handled, or who's going to,
I'll go get her.
is there a budget involved in that? Is it covered by an insurance company because of the wellness program?
Yeah, it is covered under the, under our health insurance. And they are coming.
I see the policy as somehow we've got to make it less punitive if
Well, on the
if somebody can't stop smoking on the spot.
On the phase 2, on the last page, it talks about signs are at relevant areas of the workplace, and the county's commitment to a smoke-free workplace shall be displayed, so. The signs are smoking area signs, or are they just signs that says we're a smoke-free workplace?
I can't see people that have been smoked for 20 years gonna turn around and just quit on the spot.
No, I don't either.
And if you don't think people smoke, drive through here 4 or 5 times in a day and see them out back smoking. A lot of them are the same people. You gotta have their butts. So I don't know what you do about that.
Gave everybody a copy except for me. So, are we set with the first page? Or, I know Chris was talking about the vapor one. But if you look in the definitions, the e-cigarette is part of what smoking is considered.
Yeah, that's correct. I mean, I think that's one of the things that we might want to discuss
Okay.
is whether or not those may be allowed. I mean, if we look at, I mean, because they don't produce litter
Right.
per se, they don't produce an odor that's, per se.
Mm-hmm.
And, I mean, some of them can, some of them are aromatic, to a level of, almost, I'm gonna say the word pleasant, that they don't smell bad, they smell like vanilla or something like that, so they don't smell like your typical cigarette smoke, they actually don't smell bad. So the idea of it, that somebody's gonna smell like that coming back to work is probably not.
So, in your restaurant, do you see people utilizing these?
Yeah, people have sought these out to be an alternative to smoking. They don't qualify under statute to be allowed under the Indoor Smoking Act.
So you can't use them
You can't use them indoors. But as far as them perhaps being an alternative to smoking, that might be reasonable, like, and, you know, like, because I think that's a component that's kind of missing, is we don't really say, well, we say about what isn't allowed, but we don't say like, well, what would be considered allowed, like Nicorette gum, or patches, or perhaps this would be something, you know, that would be allowed, or at least initially, for the first year, because at least there's that same sort of feeling of you're smoking, even though it's water vapor instead of the smoke. So it might be, for the first year, we'll allow the vapes, the e-cigarettes, you know, as a part of the transition. And,
Chris?
Yeah.
Why would you, I don't understand all of this because I don't smoke, but why would you consider a patch or something else you mentioned as even smoking?
I don't, it's just kind of the basic tenor of the policy. The policy doesn't really lend itself to what is allowed. Like, you will still be allowed to, you know, be able to wear patches, you'll be able to wear, chew the gum,
So
it appears here that you're allowed to use some, it says, in smoking, so the policy does not prohibit you from, that I can see, at least initially, I guess I should read it more carefully, is it does not prohibit you from using tobacco, smokeless tobacco.
Tobacco or any other substance encased in cigarettes, pipes, e-cigarettes, and cigars.
Isn't an e-cigarette, doesn't it look like a cigarette?
Well, some of them look like cigarettes, some of them are modeled after that, some of them, I don't know, look,
But don't they put nicotine in them?
yes.
Okay.
In e-cigarettes?
Yeah, I guess, that's what they call vapor.
Vaping, yeah.
Vapor, vaping.
The vapors are about, maybe they're a little bigger, and it has the oil and water, and it heats it up hot enough that it turns into water vapor, and you inhale the water vapor. It is not necessarily safe, but it is, I believe, considered a bit safer than smoking, but it's certainly not a risk-free alternative.
On page 3, I put that e-cigarettes are unregulated nicotine products for which there is insufficient evidence of safety. That's on, almost, that's 3/4 of the way down.
Yep, I see that.
Well,
Right,
there's
I
a-
understand the e-cigarettes are being prohibited.
Just on the complex, within the 25 acres.
Right.
Smoke outside of that.
Right.
But do we define the complex as,
I did, it's.
oh, it's okay on the
Complex
front
is under
page?
the definition.
What is
I
the-
would change to, I would change, cigarettes and other smoking material will not be utilized while on the county complex.
Oh, where are we?
That's page 3. It was just above e-cigarettes.
Okay.
I think we should, and then on the front you say the complex is the 25 acres which,
Consists of all occupied county buildings, parking lots, and grounds surrounding those buildings. Those buildings include in the complex, admin building and the all surrounding grounds, the Mountain View Community Nursing Home and surrounding grounds, nursing home annex and surrounding grounds, all farm buildings, and the jail and surrounding grounds.
well,
So right where it's all kind of occupied.
and that's good, but I see a problem with cigarettes and other smoking material not be utilized while on the county complex. The average person is going to think that's the whole, unless they have the policy or they work here, they're gonna think that's the whole complex. How about while on the county, a designated complex or the designated,
According to,
While on the
According to-
designated county complex.
or the complex per page one definition.
by
or-
definition of.
or something.
Okay, while on the county complex by definition.
You know, what this is not going to prevent, and I gave the example before about somebody in a nursing home bed smelling cigarettes, smoke on clothing of people who are attending to them. That's not gonna prevent that.
That's right.
They can smoke on their way in, smoke at home, their clothes would still reek smoke, no matter what kind of a smoking policy we have here on campus. The smoking policy is just one step for improving the health of our employees, trying to put a positive twist on making people healthier,
And a nursing home is a healthcare facility.
right?
Um,
And
What do you think?
what does our insurance company under the wellness program
That's,
provide?
I had spoken with Interlocal Trust, and they don't have anything specifically that they have, but there is a program offered by the American Cancer Society that's a 4-week program, and also Harvard Pilgrim, our insurer, has savings opportunities for 25% discount for enrolling in the 21-day program through the Craving to Quit program. So there are things out there, so if someone is interested in reducing or quitting, there is some help out there.
Excuse me, the 25% is for what?
Enrolling in the 21-day program
Well, what is that? Yeah, but it's
through
25%.
Harvard Pilgrim. So it's a 25% discount for our employees who are insured.
Oh, so they would realize the 25%
They-
discount?
The employee would get a 25% discount on that program.
Wow.
I don't know how
What
much the
does it-
cost,
sorry, I didn't
I don't know
quite-
the cost of the program.
We get a
but
25% discount?
The employees, whoever would participate in this Craving to Quit program through Harvard Pilgrim.
Oh, so there's a cost for it?
Yeah.
Oh.
So they have to pay to be in the program?
Yeah.
And they receive a 25% discount?
And I don't know the cost of the program, but
Okay.
that's what they have.
So there's not a 25% discount on their premium?
That's what I thought.
Yeah,
I was like,
that's
wow,
what
that's
I thought.
huge.
Yeah.
I'm gonna start smoking.
25% for
And I'm gonna join that
enrolling.
program.
Enrolling in.
Okay.
And Interlocal Trust, I talked to the girls when we were at conference, and they said that they would be more than willing to, do any kind of program that would assist us with getting them healthier and weaning away from cigarette smoking or smoking.
Go ahead.
Under complaint procedures, you go to a non-smoking.
Where are we? Page 3 again?
2 or 3,
Yeah,
Page 3 again? Okay.
the administrator didn't number the pages, I don't know where we are. We don't want to turn this into a war between, we've got enough upset employees around here. We don't want to increase it by people tattling on somebody for smoking. And you also don't want anybody saying so-and-so is smoking and they're not smoking. Why do we need in here to be submitted in writing and identify specific objections?
Specific objections?
Is that for the policy, or is that if somebody's out back of the pine tree here and smoking on, and so nobody will see them? It says specific objections.
Right,
Are we
so-
talking about somebody that's sneaking off into the janitor's closet and having a
That,
pot?
that could be one.
Or is it or is it the objections to the policy itself?
It could be both. Not like, oh, I object to the policy and I'm gonna write a complaint. No. It's identify specific objections in the policy. Like, if someone's using a e-cigarette, if we don't have e-cigarette. If someone's smoking on the complex when they're not supposed to be. So maybe I
We want
should.
that reported in writing.
Well, it's better to have it in writing. I think any complaint should be in writing.
Okay. Well, because that way they can't say we're just making it up. I mean, for the
Yeah.
protection of everyone involved, I'm making a complaint, that person makes the complaint with whatever specificity, but it's not like we created something.
And we don't have to use their name, you know, as long as we know who it is.
Yeah.
We don't have to tell the person that we're talking to who submitted it. But I think that, you know, it should have, any complaint should be in writing when you have, and there should be a process when you have a policy, you know, of what you should do if you have a complaint. You know, because some people don't know if they have a complaint, where to go, who to tell, what to do.
That's true, but it also, it works the other way. Somebody sees something and they don't want to report it because they have to put it in writing.
No.
How about if we add
They can report it,
anonymous complaint
They can,
must be
They don't want
something about,
anonymous complaints.
something about you don't have to sign your name?
No. We don't have to use their name because, you know, we don't want it to turn into a tattletale type of
That's what I'm
thing.
saying.
So that's why it needs to be in writing as opposed to, hey, you know, John's smoking in the,
What proof
In
do
the
you
bathroom.
have? What proof do you have that he's smoking in the bathroom?
oh, I wasn't smoking in the bathroom. What are you talking about? Well, someone told me. No, I wasn't. This way, if it's in writing, well, if someone's complained, you have it in writing that you were at this such and such a date and time. I don't know, I mean, it should
I'm
be,
just on I'm on the other side of that
Okay.
issue.
right. Well, yeah,
but, I mean, we can still work on it.
Yeah.
Well, I'm not saying no, but, you know, I do want to work on this. You know, we keep saying we're going to work on it, and, you know, other issues come up, and,
My concern is, Kenny, you've been here a year now, you know how well secrets are kept around this place. Someone files
do you have a secret?
files a complaint because his brother worker is smoking, and now comes, no employee will suffer from retaliation for raising the complaint. Now we're gonna move into, what was retaliation? Was it retaliation? It's gonna go downhill from here. I think that we have to have some pretty solid proof that someone's smoking.
That's why I have it in writing. Then we do an
As I said, I'm on the
investigation.
other side of the issue.
It'd be great if there was another witness.
well,
And that's why we do an investigation.
I think the integration of what happens if you are caught or if there's a complaint and how that integrates with any other complaint of breaking the rules, bullying, say for instance, you know, how that process goes about. I mean, the retaliation is on all the policies. I mean, it is a policy about retaliation for someone coming forward to say something that retaliation there's a procedure that follows it. But that integration of how that fits into our employee handbook is important. You know, how it gets referenced, so just as you said, if something happens, who do I tell? Do I tell the county administrator? Do I tell the department head who's under that purview of that person? Where do I go? So here it says you go to HR, I think is what it says.
Or the department head.
Or the department.
Yep.
And so, you know, and then how that gets handled from that point, I think is also important. And I think that how it gets handled is not necessarily should be the same way that it's handled for other things. You know, like tardiness, you know, shouldn't have the same level. I got caught smoking in the boys' room, shouldn't have the same level of, you know, tardiness. You broke a rule, so to speak. So, or a transition of it.
Yep.
You know, that initially, I think we should be showing some compassion and an understanding that this is not gonna be easy for some people, you know, and that there may be, more than 3 months might be necessary for somebody to completely not smoke. And to help within the policy is to have whatever programs that are available contained directly within the policy, not you go somewhere else to find about it. Go look in your handbook, your health benefits handbook, and it should be contained right here. Here are the things that we are doing where you can go to help you either quit, help you to be within the compliance of the policy. You can use Nicorette. You can get patches. These are available by prescription through your physician. Go get a doctor's appointment. There must be, through our own health insurance plan, there must be smoking cessation helps contained within our plan. It's gotta be.
I know the hospital offers them.
These things should be contained right within the policy, right there. Here's how we can help you quit, here's how we can help you be in compliance. May not be what we want, but, and I just think that these certain parameters of the vaporized nicotine may be reasonable for a certain period of time. It might be a year, it might be 3 months more, 6 months more, but it may not be as healthy, but it certainly cuts down on that odor. And if they start doing that at home, now they're not coming to work smelling like cigarettes on their clothes because they're using the vapes at home. It becomes what they do instead of smoking, which may not be perfectly safe, but it's at least a step in the right direction. And many of these vape, we'll just call them e-cigarettes, they have a smoking cessation plan where it starts out as full nicotine, then it weans you off of it. So by the end of it, hopefully there's no nicotine at all. You're just smoking flavored water vapor. There's no nicotine involved. So those also have smoking cessation contained within their use.
Are we overstepping our bounds and taking away the rights of individuals?
They have the right to smoke. They certainly do. But, as employees,
Because of our facility.
we have certain rights too. So that's,
And what about the people who don't smoke? What about their rights?
For the people in the nursing home that can't smoke, the patients.
yeah.
It's a really,
I mean, we're
it's a
just,
really good discussion.
all we're asking is that don't smoke for 8 hours. That's all we're asking.
What do hospitals do? Do you know?
They don't allow smoking on campus, and what you end up seeing is a few people, the few that really, really need to smoke, they go out to the sidewalk, and they're not allowed to be like within a certain parameters of the front of the building, they have to go somewhere else, but if they really need to smoke, they have to go on campus, so they go to the public sidewalk.
You go down to Huggins and you can see them out there.
Yeah, and that's what we,
Right,
if
all
we
the
have
time.
people that are that, desperate to smoke, then they'll do that. They'll go across the street, they'll go down to the road. And I don't think we'll be able to stop that, but I think that with programs, with assistance, and with making it a little bit harder for them to smoke, that will help us to have healthier, smoke-free employees, at least while they're working.
Is our risk pool, when they come in and give us our health insurance premiums, is it based on how many people here smoke?
I don't think it's based on smokers, no. It's
Because
based
I know
on-
my own health insurance premium, if I'm a smoker, it's higher.
If you do a
Right.
questionnaire.
I think Chuck did say, and he's
Yeah.
coming up pretty soon here, he can probably answer that. I think he
So
did say that.
There's probably a percentage in all of the risk pools that would consider a percentage of smokers that does affect, but, most, whether it's a county or town or school, you really don't know how many people are smokers, because it's not an individual questionnaire that you have to answer. But with that being said, having our employees who are under our healthcare program go on to the website to do their healthcare review, what's it called, their questionnaire, where it does ask that, it can't be held against them, but to be able to have them get the assistance to, if they want to quit smoking, to quit smoking. And that's out there for them. That's absolutely, for the ones that are on our health plan. Those people who are on other health plans, then hopefully their health plan has some assistance. But to be able, like you said, to be able to give them this information, that there are programs out there for them to quit, then that would behoove all of us.
Very interesting to find out what it costs for one of those programs. They'll give you 25% off, maybe the county should give another 25% off to help people get off the smoking.
Maybe we can look at helping
We would
with,
pay it.
yeah, maybe we can look at helping with those people who do want to, for the, you know, over the first 3 months of this, and they really want to quit, maybe we can look at the cost and to see.
Okay, any further discussion?
No, I said it before, when the jail went to a smoke-free facility where I came from, the county paid for the people to come in and do the smoking cessation hypnosis. And that was a pretty big success. Those times, there were 3 to 4 different times, and each time, and I sat in one of them, I didn't smoke, but I just sat in to see what it was all about. And though each class was full, there was like 20 people per class, and I think they had 4 times. And people did quit, they did stop. So it does help people. And just what Chris said too, you know, doctors can prescribe things to help with some of the withdrawals. And I know they have Chantix and other medication that you can take, and that helps with that.
Well, you see it advertised on television all the time, ways of stopping.
Yeah, so we could bring people in like that.
You know, a hypnotist, if we brought a hypnotist in, you know, over a 3-month period for those people who really want to, you know, why not look at the cost of that? If we feel so strongly on this policy, then, you know, we can.
We need
Help.
to back it up.
Yeah,
Better for everybody.
absolutely.
And it makes a healthier environment.
Yeah.
And then there's those who won't stop, and that's okay too. But while you're here,
But just helping to be able to manage that though. You know, because I think, well, to help them be able to manage
Yeah.
that is like, okay, well, I can't smoke, you know, except for maybe during my lunch break because I can't leave. So I hop in my car and I drive across the street and I, you know.
smoke 4 cigarettes.
Right, yeah, I binge smoke and then zip back there. So, you know, so what are the alternatives? Well, you can chew Nicorette gum. You can wear the patch. You know, these, you know, like, well, what do you know? These same people, they must go on once in a while a 4 or 6 hour flight, and they can't smoke there. So what do? It's the same. It's the same sort of thing.
That's interesting.
We're not trying to say you can't. You're addicted to nicotine, so therefore, but while you're at work, you cannot have the nicotine. We're just saying. You know, the effects of your smoke affects the people around you and the environment, the work environment, we'll say. And that's really the, you know, what we're trying to move forward on.
Let's look at the costs and let's find out what's out there available and what we can do to promote or encourage people to participate in a program. And depending on the cost, maybe we foot the bill
Yeah.
for a 3-month period and see if it helps.
Have them come in once a month or something, or however much they think would take to have people who want to quit. Or at least to be able to go without smoking for the 8 hours while they're working.
Yeah,
Okay.
That's a good point. You're on a flight, you can't smoke if you're going
That's
to
right.
Hawaii or something.
Yeah.
That's a long flight,
Yeah.
so.
Okay, any other further discussion? All right, see if we can
So next week,
do some more work.
next week I'll bring back some of the costs, some what we can
Yeah.
do. I'll put within the policy, the compliance, you keep that, the helpful hints and, you know, helpful hints on what to do. What do you want to do about the e-cigarette or vapor? Is the board willing to keep that in it for 3-4 months? As a, you know,
As an outdoor alternative. I mean, it shouldn't be confused that you can now do this inside,
No,
because
no,
that's not legal.
that's
That's
still
still not legal, so that needs to be an understanding that, you know, in these, in the designated smoking areas, I'm presuming we have those now, that if you do smoke, it's in some sort of designated area, those will be allowed for
3-4 months.
whatever we agree on as a reasonable time to help people.
Is the board willing for that?
Transitions.
Yep.
Okay.
Can I ask what might be a silly question?
No, go ahead.
If we go forward with a non-smoking policy and it reaches the point with an employee that we have to terminate them, are we going to put some money in the budget to cover their accrued time?
To cover their what?
Accrued time if we have to let them go?
Right. Well, that's something else I think I'd
You know,
like to see.
we don't know whether it'll be 20 people or 2 people, and if it's a large, I'm just a believer that people can't stop smoking like that.
Well, the
At some
first
point,
3,
we're
4,
gonna-
5 months, there'll be a considerable leeway given.
Gonna
But
have-
still, you know, they still have to try. You can't just say, you know, you can't give someone 8 written warnings, 8 verbal warnings, and then they still continue to do it for the next 3 months. I mean,
Right,
there must be some improvement.
right.
I would hope that we wouldn't have to terminate.
Yeah, I don't-
somebody
I hope not.
because of smoking.
Yeah.
But certainly that I think, that's something that I would like to see though, is that there is a transition time period upon which only verbal warnings will be given. Like for 6 months, you know, that you'd be given verbal warnings.
Wow.
And then after that, then,
You're gonna be giving one
Thanks.
every day for 6 months? I know, I'm just
Perhaps.
asking, is that what you're thinking?
perhaps,
Well, David, if we're going to have this policy at some point, whether you like it or not, we've got to drop the hammer.
Correct.
I'm not in favor of doing that. But we ought to be prepared, if we put this in effect, to be able to cover all of the consequences that might come from it. First of all, we need, as Chris says, 6 months, because we need help over here. B, we're gonna have to pay them for holidays and sick time and whatever else when they leave. So we need to have some money available for that, whether we use it or not. And then I suppose we have to be prepared for a lawsuit that somebody will find some reason to sue us over it.
true.
I hope it doesn't happen, but.
Okay, let's move on. We've got some things that we need to do to look into regarding that policy. And we'll continue to work on it, I guess.
Okay.
I know it's not on the agenda, but I have a concern about boundary lines of our property. They have not been looked at in the 18 years that I've been here, and probably prior to that. I'd like to propose that we put money into the capital reserve to do a portion of it each year.
Okay.
And
5-year program, Dave?
5-year program.
Or
yeah.
3-year, or?
And put $10,000 into the budget to start on it next year. Anybody got comments on that?
Yes,
Go ahead.
is there an RSA that requires us to do that?
No,
Every
but I think
50
we ought
years?
I don't think so.
I think we ought to know where our boundaries
Well,
are, and
you
if
know.
anybody is encroaching on our boundaries.
I mean, we have changed a few things, like down at the school, there was an adjustment done there. Across the street, there was an adjustment done there.
Yeah,
But that, I don't think that was ever surveyed, was it?
I don't know.
Yeah. See, so this is some things we should be looking at. I think you're absolutely true.
Yep.
And we've been doing a lot of logging every year, so, and there was some logging done up here in the far field.
Yeah,
That was an issue sometime, a few
I
years
think there are
back.
some areas that we could pick out that would have a higher priority than way out in
The boonies.
the boonies.
In the boonies, that's a place to go.
Where the ski area is and so forth, or was. But
Ski area?
anyway, we had a ski area across the
Really?
street, yeah.
Huh.
So anyway, that's,
Well, I don't know how it goes.
any further comments from other board members?
Oh, I think you're right, and we also, maybe that'll help us establish how many acres we have here. Every time you talk to somebody, it's a different number.
It's 1,000, it's 900, it's 800, it's 700.
I'd like to make that motion.
I'll second it.
Any further discussion?
And you get $10,000
At
bucks?
$10,000, and do it over a 5-year period. I mean, the 10,000 would be up for 2017. And have a program that every year for the next 5 years, that money be set aside to do that. Any further discussion?
We
So
can't,
you're
yes.
saying 2,000 a year, essentially?
No, I'm saying
I'm
10,000.
saying 10,000. I have no idea what it would cost. I'm sure that they're getting pretty good money to do surveying. I know on my 2 acres I had in North Conway, it was expensive. I was shocked to see it.
Really?
Yeah.
I
But
think
maybe
it's
that is a little different.
like $1,200. Was it more than 1,200?
Oh, yeah.
Yeah.
Wow.
Oh, yeah. That was only on 1 acre piece. Anyway, all those in support of the motion say aye.
My head,
Go, I'm sorry.
we can't obligate another delegation to do this, so we only have to do.
Sure you can.
You can? We can make this up, and maybe you
We have a
want to
five-year-
change it
we have
to
a five-year capital
program
plan.
that commits $10,000 a year.
They can certainly cut it out,
Right.
They
But
can
you
either
can
approve it
certainly
or disapprove it.
put it in.
Yeah.
So once you do, what did it make?
Okay.
5 year.
I mean, you're only voting to put it into the capital plan. You're not
Right,
voting to spend the money because we don't have it yet.
yeah.
Yeah, you can do that.
So
How
I'm
do you
just
want-
confused in the cut.
Yeah, how do you want the motion?
The, for the next
Yeah, we have a 5-year.
5 years, we put $10,000 into a capital reserve fund, or do it, either one, you know.
I'm not sure it's gonna cost us 50,000 to do it. That's my only concern. But the first year would be $10,000.
Okay. And when we find out what it costs, if it is.
Then we
put
go
it back
back,
in the
you can
general
go from
fund,
there.
yeah.
He's only got 67 days left.
Any further discussion?
I guess I'm just a little confused about what we're doing. Are we, if we're establishing a capital reserve,
Right,
I mean, typically, you know, maybe I'm wrong, but typically what happens is you establish a capital reserve and you agree to put X amount of money into that capital reserve.
yeah.
So when at the time you need to expend that money, it's there. Whereas this almost seems to be, I'm not sure, so we're gonna put $10,000 into capital reserve, so then you can
For
expend 2,000?
2017, for the purpose of resurveying our boundary lines.
Okay, well, it just sounds like it's part of the budget.
Yeah,
It's not a
we're doing
capital
motion.
reserve.
Okay, whatever.
But you can just say, I want you guys to put $10,000 in the capital plan. Because we've already got the capital plan already
Yeah,
done.
that's
okay.
there.
So we add 10,000, 2017, 18, 19, 20, and 21. So where we go.
I don't know if we have to go the 5 years. All I want to say is that it's time that we reviewed and had somebody, a surveyor, look at our boundary lines.
I don't,
And
you
we
know, I
put
don't
10,000 in it
disagree. I think
to do it, do whatever they can do for $10,000 in the year 2017. And hit the most critical areas that might be of concern to us. John, you got a quick question or a comment?
Have you considered consulting with the deeds office on the records that are already in place?
We have looked at maps and they're very old.
Does the
We've had-
boundary line move because they were old?
And we've had some changes
Some,
with the courthouse. We've had 10 acres added to our property across to Route 28.
and
We've taken 2 acres out of it. They were supposed to, the school was supposed to pick up the cost.
Anytime
doing
a
that.
change takes place in boundary lines, it's surveyed. It has to be.
No,
only if you file a deed, and sometimes people don't
I just
file
bought
a
some
deed.
land and I didn't get it surveyed and I put it in the registry of deeds.
Go ahead.
Ann Eaton, just before she left, did a extensive study on all of the properties we have. It's all one property, but it's broken up into however we've purchased it or acquired it over the years. And that's right up to date, but that doesn't help us with a survey. I mean, they could be wrong.
Okay.
Okay. Where are we?
We are at the 2017 budget review.
Did we pass that motion, correct?
No,
Or did-
No, you
no,
didn't
you
vote on it.
didn't finish it.
We don't need a motion. Because we're only putting money into the capital plan.
We're not.
I mean, I could do that on my own, really.
Okay.
Is the capital plan going to be part of the 2017 budget?
Okay,
Yeah,
let's go back to our agenda.
I passed out to you guys a couple weeks ago, we went over it. But, all right, we are gonna start with the budget reviews. So right now, we're gonna start at 4100, 4101, 4102. I'm sorry, yeah, not 4102, 4103. And 4110, right? And what else? And the county convention, and the 41, what are you, 93? And 4193. So let's start with 4100. What we did was we moved me out of my own budget and put it into the commissioner's budget. It didn't make sense for me to be up on my own. So we just moved some of the costs, my salary over, and so that's a change. And we moved a lot of my associated costs over as well. Chuck, anything else that has been
There is
moved?
no amount in here yet for medical and dental, because I won't have those figures till mid-November. I will not have the guaranteed maximum rate until then.
Although, I'd like to share with you,
This is depressing.
huh?
This is depressing.
Health Trust increase for 2017-18. Town of Swansea has a 5.3% increase. Town of Derry has a 22.8% increase. SAU 21, 22.8%. The Town of Durham 16%. Merrimack County 16.9%. Newport 20% increase in health insurance. These are just huge rates, huge increases.
Any reason given for that?
And we don't belong to Health Trust, but,
It's just trend.
yeah.
Well, aren't we guaranteed like 10% or something because we signed that memo over the summer?
Yeah, something like 10 or 11%, wasn't it, Chris?
We already, it did go up 8%, right?
I mean, because we belong to a certain thing, right? It's guaranteed not to go up more than a certain percentage.
No, you're talking about
Is that the,
That was
right?
our risk for
That's
our
risk
health.
that was Primex.
Yeah,
So that's for what, workman's comp? or-
yeah.
Yes.
Workers' comp,
Workers' comp.
liability.
Property liability.
Well, the sheriff's department too, the union, right? Wasn't that a guarantee that it wouldn't go up over
We're-
a certain amount?
Right, but this is health trust, we're talking about
Okay.
interlocal trust.
Okay.
So if this is what we're seeing at health trust, we're not sure what we're gonna be seeing at interlocal trust.
And when will we know the amount that it's gonna be?
I may know something on November 8th.
Remember last year, we were told 10% or 13%, and we went into the budget year, and we didn't find out till February or March that it was actually 8%, so. But, I mean, we go through this every year, same, you know, the same wonderment.
Why is the finance director's part of the Mountain View community?
My salary is split half for the county and half for Mountain View. Half for
Why?
100 and half, because
Why?
it spreads it out. Because I
What?
service the entire county.
Why wouldn't it be 100% under this?
Because under the cost report, we can only take out a certain percent, and that's 50%. It was 75%. But we thought that was way too high. So prior to Chuck, it was always 75-25. Now, last year, we dropped it back to 50-50 because Medicaid isn't gonna take 75%.
Okay.
Ken, why is the county administrator under year-to-date, has it got a 0? Is it somewhere else in the report?
It was 4104, I was in my own budget, but it didn't make sense.
I understand that.
So
Why don't we just take the figures from?
Because it stays with the
Moving
4104,
forward.
because it stays with 4104, that you can't intermingle numbers. You can't drag over 4104 to 4100 now.
So we can't take your salary to date and put it in,
It's right here.
and put it in.
Like we did last year in a lot of these accounts, we had to look back and look
Right.
back.
Okay. Understood.
Commissioners, that dropped down a little bit because we know that delegation changed the amounts. For the two new incoming ones, the old one stays.
What were you just talking about?
About the commissioner's salary, remember
Salary.
Okay,
delegation
yes,
reduced
yes,
it?
yes.
So you'll see about a $3,300 reduction, $3,600 reduction.
You will not be getting retirement.
Other counties do get retirement. right?
Will you get retirement?
No, other counties do.
No, I just said,
Stratford County
joking,
gets
he won't get
retirement.
retirement.
Did they get health benefits?
George gets retirement.
Oh, he does? Wow. I know he gets health benefits.
Yeah.
The retirement rate reflects a change at mid-year, July 1. The rate goes up slightly for employees and up significantly for police and fire,
Right, so group 1 goes up a little bit, group 2 goes up quite a bit.
about 3%.
So I just want to turn briefly back to just talking about the finance director and the splitting of his salary with
Mountain View.
the Mountain View. And to that end, though, I'm also curious about the rest of the business office salary and how much they should be apportioned toward,
Payroll.
yeah.
Accounts
Yeah, that's it.
payable is 75-25 split, with 75 in the county and 25 in the nursing home. The payroll is split 50-50, just like it is.
Okay, so there is also a split, it's just not designated in the little,
Yeah, we haven't adjusted all the notes yet to
okay.
reflect all of that.
Okay, I was just making sure that I thought perhaps maybe it was overcompensated towards the director because we weren't doing it for the other people and it just kind of came out in the wash, that amount of money was correct if you did do consideration of all the personnel. So, but it sounds like that's not going to be an issue.
The retirement is up 50% for the commissioners.
I'm in there, mine's almost 13,000.
You know, I
Again,
can,
all the associated costs are going from mine into this one.
Okay, but last year was 10.8,
Change, look over the page,
115,
and mine was 12.5.
and last year it was 19.4,
Mhm.
and it's going to 29.5. If all of yours is in there, the 29.5 should be greater.
No,
Did you just say it was 13,000?
no, it's 12, well, it's 12,520.
You also have to adjust for the retirement on 50% of mine, 50% of payroll, 25% of accounts payable.
I understand that, but is this enough? It's gonna cover it.
Yes, I have a separate spreadsheet that you saw.
Okay. You're a numbers man, I'm not.
Are we going to, I can see the frustration of the delegation, because every year we budget, we switch items to someplace else. And it's very difficult for them to follow, difficult for me to follow, all these things that are changing. I know it's probably proper that the administrator be underneath the 4,100. But I hope we try to keep that to a minimum.
And I think why it wasn't was because I came in half year or something. I'm not sure why it wasn't put on the commissioners.
Okay.
Every other county, so they don't have their own budget.
Yeah.
I just thought it was kind of strange, because I'm so little, as far as all the stuff I use, like, copiers and office supplies. And
I noticed that office supplies has jumped.
where's that?
$1,600.
Where are we?
4,136.
From 2015 to this year, it's almost.
No, from
50%.
3,000 to 3,600, $600. I don't know why you think that's huge.
Oh, I'm saying from 2015
Yeah.
to 2017, it's almost a 50% now.
Again,
50%, 50%.
let's look at 15 to 16, okay? That was almost $1,000 jump. It was actually $962, $68. Then my $600, so we didn't increase it this year. We just brought over my 600.
Okay.
Okay,
So whatever happened in 15, again, there were line item transfers. We took out, we took money away and gave it back to the delegation for that, the 139.6. That is going to reflect in the 15 budget.
Is there any
You
way?
can't look at 15.
Yeah. Is there any way that you can put an asterisk or something where we had to require a line item transfer? So that they would then know that, it was underspent or overspent?
We're not even going to have 15. This is just ours. If you look at the other budget, it does have 15 in it.
Is there a way of?
I guess we have it on a spreadsheet.
How
We give it a
many
spread-
did we do?
Well, in 2015,
This year?
this year we've only done 29,
29.
21.
Is there any way of identifying those areas that we had a transfer?
We are going to hand them out a spreadsheet, and it'll reflect in the budget. In the fourth quarter, you'll see it in the budget,
Okay.
where it's been taken away and where it's been put into, like we did last year. And I apologize to Frank McCarthy that we didn't do it this time. I totally forgot about it until we started going over the budget. And then Chris came up to me and reminded me, but we were saying it at the same time.
Yeah.
So,
And he was very gracious in the fact that he did say, well, I really was only expecting that during the budget process and not
Absolutely.
necessarily during the quarterly review. He was very gracious about that. I thought that was nice.
Before I forget it, Chuck, would you find out where the $10,000 insurance was put into the budget?
I talked to Kathy already. It was
Did it already?
4 years ago. And she has to
That long
research it.
ago?
Yeah.
Wow.
And she has to know,
Nice, huh?
when it was. She's thinking it's around 2011,
Wow.
so. But she has to go
Okay.
through everything.
That needs to be sent to Representative Chandler.
She's on it, she's working on it.
Okay.
All right, so let's keep going, because we have a lot more to go. So, you know, it went up $400 in my postage because of me. The telephone went up. Travel expenses only went up because of the county car. So I didn't bring over my whole travel. There's really a huge savings in the travel. If you look at the commissioners, on the second column, year-to-date, in the travel expense, in 2015, we had $4,100. So far to date, we've only spent $1,700, and we budgeted $4,950. So we're not sure about the incoming commissioners. We're not sure what they're gonna use now. I know Chris doesn't, you haven't put in for mileage, have you?
No,
Okay,
I haven't been.
okay. Are you going to, at some point?
Oh, you mean like aggregately say,
Yeah.
boom, all of a sudden, here's my whole year's worth of mileage?
Yeah. I don't know.
How much is it gonna be? No, I have no plan.
Probably quite a bit,
Yeah, I have no plan.
at
at
least
this time.
$1,200.
Yeah, I have no plans
Okay.
to submit my mileage.
So that's why we don't have a huge mileage. The only one that's taking it is Commissioner Sorensen, and when you go to Concord or some other place, other than back and forth to the county.
I would like to mention though, that only having kumquats in the candy bowl may sway my.
I mentioned that, but we are going healthy. So, you know, we are trying to reduce our rates.
You know, well, a couple bags of candy could save $1,200 to the county, that's all.
Another question is, in our insurance, if we were to go smoke-free, would that have an impact on our health insurance at all?
Premium.
Time. The healthier you get, the more committed you are to wellness, it affects your rate.
Any idea how much?
Because I have no concept of how many people are smokers and how many people actually work out, or how many people eat healthy.
Yeah,
The insurance companies have that kind of data,
they do.
but they can't share it with you, except in an aggregate form.
Not even numbers they can't share.
In a general aggregate form, they can do that over time, but it's hard to quantify, but it really has an effect. I mean, that's what they preach, is be healthy and raise it.
Yeah, yeah.
Would it be possible maybe just to inquire maybe with them on, because they're, what data is there, and if we can get half of them to quit, what we might realize as a savings, or to give us some sort of idea of the potential
Yeah.
savings that's out
I will bring
there?
that up on the 8th when I meet with them.
Okay, because
Yeah.
it's a big number. In the line, we pay a lot for it, so, even 5% is gonna be a substantial amount of savings.
Mr. Babson?
Yeah, I am, before we're done here, I don't wanna skip over travel expenses so quickly. I only live 3 miles from here, so, but I think the taxpayers ought to know that Chris is making a very generous contribution by not taking his travel expenses. He could get, if it's 10 miles, he could get roughly $10 every time he comes over here. And he's not taking that, and I think he deserves a lot of credit for that. And I don't think that other people recognize that.
I agree.
Well, I didn't do it for the recognition.
So I'm,
Yeah. Well, you're
it should be
different.
noted, though.
I'm
Really?
raping the system?
No, I don't mean that at all.
Thank you very much. I'm not
You
running for reelection, but thank you.
You legitimately live 20 or 30 miles from here, and it's time and money for you to get here.
It's gonna be the same for the next person
Well,
From up in your way, and,
in Conway, and if the guy from Chatham, it's gonna be even further.
right, so we're not sure.
Well, I'm not saying, no, I'm just, thanking Chris as a taxpayer in Carroll County for not taking his allotment.
Absolutely, yeah, he's taking it for the team. Taking it for the team.
Just remember the candy.
All right, any questions of 4100 before we move on?
We're gonna
Yes.
try to get out of
Town
paying
taxes,
Ossipee
we ought to
town
be paying
taxes.
more.
No, that is, I can see that someone made a mistake. It should be 7540, not 7450. So they just inverted the two numbers, and that'll be corrected this afternoon.
I can guarantee you the taxes aren't going down.
That's what I said, somebody inverted it, that's all.
I-
No
I
problem.
heard- I heard that.
Is there,
But it should go down a lot more, but
is there a way of finding out from other counties whether they're paying town taxes?
I can tell you from Stratford,
You are,
I can tell you
are they?
that they pay $4,000 on two pieces of property that are across the river.
$4,000.
That's it.
How many acres?
They're two acre parcels.
Oh,
It's
So, 4 acres.
the old water, there's an old water pump on that property. So that's why I believe we should pay less, but some people disagree.
Yep. New equipment. Stand-up desks, what are they for?
They're for some employees who have hip and knee issues. And they will, because it's hard, especially for some of the employees who have to sit all day and they have knee problems. So it's better for them to stand up, and when they stand up, it comes up with them.
See, and when are we gonna purchase those?
We have a couple samples downstairs,
I see.
and we are looking for a new printer in Chuck's office, because I hear a lot of banging going on in that office. Is that a hand-me-down printer?
I
And-
handed it down to him.
And Cheryl, I believe, you have the new chair in there, or someone else? Yeah, and Cheryl needs a new chair for her back, so. So we're not sure about how many more stand-up desks we are gonna be getting, but the chair is a few $100s, and the printer is $750 or so. Anything else, Mr. Commissioner? Last one? Okay. 4101 is the treasurer's salary. I don't see any big issues there. 4102, we're waiting, we're skipping over that. 4103, human resources. No big change, although we do have a change in the salaries. Why is that?
Because the other position that was in that account is now under finance.
Oh, the HR, the benefits payroll person, okay. So that's been moved over to 4100, and the business office salaries. You sure? Okay. I'm gonna recheck down, that doesn't look right to me, but are you sure that that's right? 109,000. Okay.
Because 50% of one of the positions goes to.
Oh, that's right, you're right, you're right,
25%
you're right, I'm sorry, you're right. So the,
You were talking about a person over at the nursing home. Is that a nursing home budget? Or is it under the HR budget?
we're not doing a nursing home person at the nursing home. We had talked about it in non-public, so we need to
Okay,
stay away from that.
okay.
And so all the other ancillary numbers are also go. Other than that, Winnett's budget is pretty much solid and either at level or below. She reduced a couple other things. We have increased the advertising now $750 because we're having a lot of advertising,
Now, they're gonna look at year-to-date on education and conferences.
Mm-hmm.
We only spent 1,200, that's half of what we budgeted for.
Where?
Education and conferences.
I don't think the bill was.
401,
Remember, this is only for 3 months, this is only for 9 months.
I know.
She's going to another conference and the training hasn't hit here, she went in October, you just went last week.
Right.
So there are other
Okay,
invoices that that will be coming in, and it'll be pretty darn close.
okay.
Other than that, her office supplies went down, of course. The Medicare went over to 4,100. Her postage went down. Travel expense went down. New equipment stayed the same.
What's the new equipment?
Locks.
Yeah, because we're gonna be changing some locations of cabinets and stuff, we have to have them locked, and they need to have new locks in them, because there's no keys for some of the cabinets, or they have to have a lock set in them.
Where are they gonna be going?
Some will be in the vault, but some will be in other locations.
4110 is the county attorney. Did you want her here?
At some point in time, we should.
Well, then let's do it now. I mean, I think she has court all next week, so.
She has worked on the budget?
Yes, I worked on it with her.
Okay. Storage shelves and boxes considered new equipment?
Office supplies or new equipment, either line. Because it's more like equipment than supplies, the shelves would be more like equipment.
Yeah, she's in court,
All right,
but she is asking for a new position. I know, for the felonies first. So there's that's the increase. She's asking for a $58,000 attorney to handle the felonies first.
is that separated out or is that included?
It's included. You see everything to the right?
Yep.
72.5 is what she has now, 64, 61,
And
and
at
58.
72.5, we're not going to have one for
That'll
at
be
least
her
3
deputy.
months? So it's gonna be,
But that'll be her deputy. When she comes in office, she's hiring a deputy at 72.5. So that'll be in January.
what about this new position that's been delayed for 3 months?
That's the one for, it's only 58,000 because it's only for 9 months.
Okay.
Oh, okay, so that's not the starting salary. I mean, that's not the year's salary. It's
No, I think it's, I
9
think,
months.
well, 9 or 10 months, all
The
depends.
last
She wants to
one-
get them in, and, before felony starts in April, so probably, like, March. She'll like get them in March, a month before.
Well, let me think about this for a second. If it's 9 months at 58,000,
Yeah,
at the full year, that person's gonna be making more than the one at 61.
72.5.
No, it'll be about 60, I think she wanted it
That's
in at
a payroll.
62.
Oh, I
She
see.
wanted it in at 62,000 for the full year.
Well, okay, so if this is for 9 months,
Mhm.
that's, what, 7,000 plus a month. That's another 18, that doesn't come out to 61 or 62. my math, it doesn't.
That's the salary, so it's not any higher than that. So I just have to readjust that 58,000. Oh, I know why, because we did the budget with felonies first starting January 9th. That's why it's at the 58,000.
Oh, okay.
That's why. Okay. And so she couldn't hire the person until after she gets in office, so that would be another month gone down the road.
Yep.
So the salary was at 60 to 62,000, so.
Okay.
Because we just learned on Monday that now they're not starting until April 9th, April 7th. She's asking also for a part-time law clerk. So I don't know if that's gonna happen or not.
Where is this person gonna go the other half-time?
Nowhere,
So it's gonna be a
just a.
15 to 20 hour a week job?
Yeah. Just to help with, she wants someone to help with all the indictments. I mean, this is what she's asking for. I don't know what's gonna happen as we move forward. You know, maybe one attorney's good enough. I'm not sure.
What does the paralegal do? Isn't she capable of doing the indictments?
I don't think by law she can. I think it has to be an attorney that has to do them. I mean, I think she can type them up, but I think, you know, Chris? It has to be an attorney that does the indictments.
Well, I think the paralegal can probably prepare them, but the attorney would
Review
have to sign off on them, I think would be.
Then I would suggest under the memo, we change it from a half-time law clerk to a half-time lawyer. Or something that would indicate to the delegation that this is more than, that this person on the part-time is more than just another secretary.
Okay. And the paralegal salary's been reduced because, you know, Betsy left and she's at a higher salary. Michelle came over. And so the attorney's salary remained the same. That was from the delegation. And all the other ancillary retirement, Social Security is also reduced. The education and commerce remained the same. The criminal case is reduced. Other fees and services are the same. Office supplies is reduced. Dues, license, and subscriptions is up $600. She wants to put a spots terminal in. Because apparently they have to run background checks on all juries and cases.
Why doesn't the court system do that?
No, it's either the sheriff does it for them now, but she wants to be able to just do it, as opposed to letting the sheriff do it.
How many on campus do spot checks? The
Jail
sheriff and the
jail has it, and the sheriff has it. In the other counties, the county attorney also has a spots terminal.
Is that the one we send $300 or $200 a head?
No, this is like,
Criminal background checks?
no. This is more of the NCIC, it goes to the FBI, it searches everything about that person. You know, driver's license, convictions, histories, everything you want to know about that person. And this is what she wants. Postage has been reduced considerably. The telephone's been reduced. The travel expenses reduced. The photocopier expenses reduced. As you can see, in 2016, they've only used $62 worth. So she has put in $2,700 to move some power. In the office, they have all the power, all the phones and all the computer power. It's right in the middle of the office. It looks awful. So we'd like to be able to move that in, around the corner into the back room so you can't see all the lines hanging from the ceiling and coming out of the wall. And
Let's explain that a little differently and say that it's more efficient to put it there. Not just because of the.
well, it's not more efficient. I mean, it looks terrible. I mean, it looks like you're walking into like a telephone room. And it's loud, it's noisy. She wants to purchase another printer, and when they did the offices, when they made the offices and get rid of the cubicles, each office has its own light, but you can't turn them on and off. So they put the boxes in, we just have to have the wire run from the box up to the light, so they can control the lights if they want on or off. It's like they're either all on or they're all off. And if someone's in their office, why do we have a light on? They could just turn it off.
Kenny, what happens, this is the second request from a new printer. What happens to the printers that we have? I don't ever see us going out and trying to sell them, or any one of the department heads putting it on Craigslist to get rid of them. What do we do with them? Pay at the,
They go in the
Yeah.
dumpster.
pay
You
the
have to
dump?
ask John, I don't know what he does with them.
Once a printer's to the point where it's drawing curse words from his operator, then it's time for it to be a boat anchor.
I don't,
There's no resale.
I don't dispute that, but, I mean, we've heard the computers here, they're too slow, we need fast computers. Now we try to find a laptop to put down in our office, and they're not available. Where do they go?
They go down through a chain from high-end users to people who have less need for speed,
Right.
for instance, and memory, and then they eventually end up in the dumpster or recycled. But there's no resale value in particular. And printers are notorious for when they reach their end life, they're trying to get rid of them because they drive you nuts.
That's wrong. Jesus. Okay, are we done? Next would be Will. 4193. Oh, if you look at the BEAS line, 4190, that's actually gone up to 5.2 million from 4.9.
It's going up how much?
We went up about 225,000.
41 what?
Right above the farm.
Let me get to the farm. What page is that on?
4190, page 6.
Page 6.
6, okay.
Actually, I think it's 325,000, not 225.
No, yeah. Whatever.
It's a lot, though.
Yeah.
Well,
It's typical, I guess. It's about 300,000 a year.
Shocked? I mean, I don't think anyone's shocked.
From 15 to 16.
Well, if
It
you look at
seems to be
50,
consistent,
4.6,
though.
4.9, 5.2, next year it'll be 5.5.
That's a good one for a commissioner.
Yeah, the 4.6, I don't know how accurate it is, because remember, they under budgeted that year, a couple 100,000?
But look, actual,
But the,
that's actually what
oh,
we paid.
correct. Oh, okay, thank you.
So we added that.
Yeah, so, right, so it's going up about 300,000 a year.
About the same thing, yeah. So, the overtime stayed the same.
Oh, DPW.
Yep, DPW. Now, again, there's, we're gonna see, this isn't gonna match up with anything because of the reduction in April and, so 95,088 is the salary for the two full-time positions. That's what it costs. So we've taken Joe out and the one we laid off. Again, all the ancillary numbers are reduced. And we've added in another $150 for certification because Mark will be certified now? Or is it more?
I gotta, if I have questions as we go, because
Yeah,
some of these have
absolutely.
changed since what I thought.
If we're on the same line, don't
Right,
go ahead.
right,
Yeah.
yeah. On this education line,
Yeah.
I'd be more comfortable with closer to 500 because I could not take any, due to budget cuts this year, I did not take any classes at all.
Oh, okay.
Meaning I have to take all my classes next year to keep my certifications. So I would be more comfortable with another $100 in there because I'm gonna have to take probably at least 4 classes
Okay.
just for myself next year.
The water testing stayed the same. Contracted fees and services went down 500.
Question?
Yep.
Two questions on this. It's now, this year, or this last year, it got changed to contracted fees and services. It used to be called supplies and services in that line item, and 4,000 I think is too low. I think we should be at least, I originally asked for 7,500, but reevaluating, I would like to see it around 6,000 instead of 4,000. That's the line item that things, several different things, from shop supplies, for the inmates that we use in the shop, to sawdust, to baling twine, to bags for the bagged firewood. There's
So-
several different things that go in there.
So this year you're going to use $2,400.
Correct. There are, I thought that number was higher, to be honest. Well, then can I back from 6 to 5 and meet in the middle since you got 4? I always used to have 6,500 in that account. There's some things we've cut back. We didn't buy, for example, we didn't buy sawdust at all this year. We bought very little bags this year
What's the sawdust for?
to mulch the blueberries.
Oh,
And it's been a concern of taking care of those properly.
is that something we have to do? Yeah?
Yep.
How about we go up to 4,500? Can you live with that? I mean, you're probably gonna have to.
Yeah, I was gonna say I'm gonna have to, if that's what it.
I don't want to go over anything that we don't have to do.
Hopefully it just doesn't get cut anymore.
Yeah.
Are we gonna spend what we budgeted?
I've got a few more things to spend that'll go in that line item between now and the end of the year. Plus, I know there's been some stuff in the month of October that has gone to that line item. So I got a feeling that it's gonna be pretty close.
Okay, so we
To
do
that.
4,500.
Willie, where do you put parts?
For what?
Right.
Parts for the truck, parts for...
We sign every pay period, there's always something in there from Napa or the other one over there on Wolfboro.
Yes.
And I find it hard to believe that we've only spent $2,400 of the ones I've been signing this year.
Right, very rare, depending on what it is, but very rare parts go in there. So there's certain line items, if it's a water and wastewater part, it goes into a different line item. If it's a part for machinery, it goes into a one line item. If it's a part for trucks, like Ken said, it goes into another line item. There's different line items as we go, and I don't want to go ahead, but that those would go into, depending on what it is.
Okay.
Sorry, I was yawning. You're not boring, I was just yawning.
Everything else looks the
Lack of
same as we move forward. The electric stays the same.
Oh, I'm sorry.
Yep.
Can we back up a little bit, under dues, license, and subscriptions? We got 200, can we raise that to 250? Just because all my licenses are due next year, and then Mark's will have to be paid next year also.
So do you think 250 is enough?
Yes. Just an extra $50, I think, will be plenty
Okay.
on it.
And we move forward.
How
Anything
far-
else you want to jump in here?
How far forward are we moving? Are we
We're
down to
moving down.
electric now?
Yep, we're
Okay.
electric. You have any issues with that?
No,
Okay.
not yet.
Gasoline?
Yes. Sorry, that, I have it at 5,000, I guess we could leave it at 5,000. I'd rather go up to 6. We reduced it a lot this year. Prices have gone down, but we also had a mild winter last year, so we didn't burn as much gas plowing, and it's hard to predict what we're gonna have for a winter. Personally, I'd rather have just a little bit extra due to prices and the winter in there, so we're not trying to ask for money, but if we wanna leave it, I just wanna put my 2 cents in about that.
You've used 2264 so far this year,
Correct.
and if we double it, that's still only $4,500.
Okay.
And Will, you said using 3 trucks.
Yes.
How many trucks do we have?
5?
3.
Well,
Four.
3. Well, 3 that take gas,
Right, 3 that take gas.
and 2 that take diesel.
And that was gonna be my question, and what about the 1 truck here for diesel fuel? So we only have 4 trucks?
Yes.
Mm-hmm.
Okay.
So we use it in the lawnmowers, the gas is used in the lawnmowers and those 3 trucks. And 2 of those are the trucks that do all the plowing on the complex.
Okay.
So we're talking $4,500, you get an extra $500, 5,000.
Okay, I mean,
Stay there.
okay. I just wanted
If
to
not,
put 2
then-
cents on that.
If you need more money later on, we can just take the diesel and put it in the gas and see what
And when
happens.
we get to that line item, we'll have questions on that too, so.
Waste removal,
Yeah, question.
go ahead.
I think 14,000 is a little low. I'm getting ready to bring you all the stuff for the bidding process, because that's only 1 year out.
Yep.
We got a new person this year who bid pretty low, and that would be probably close to enough to pay for him, assuming there was no emergencies that came up when we had that emergency pumping.
Yeah.
So if he,
When are you going out to bid?
it'll, December. It's for the new year, so we'll start the new pumpings in
Tell you
February,
what,
so.
if you want to raise it, you go out to bid now, and you get prices. And then if you can do it before the end of next month, we can change it,
Okay.
okay?
How about changing the name of that category from waste removal to septic removal, so? Because we have waste management over at the nursing home, and surely somebody in the delegation is gonna think that that's
Okay,
just
so
the trash.
septic removal?
Yeah.
Don't we have that somewhere else, Will? Septic removal
Maybe in one of.
in
the
this
bottom-
building?
Yeah, this building.
Probably in this
of
building.
the nursing home.
Is that all right with you, Will, if we move it to, change it to septic?
Assuming the prices come back the same, that still won't give us a little buffer there if we had to have an emergency pump done. So,
All right,
You gonna spend more than 7,000 in that category this year?
we're pumping tomorrow,
well, he's got 20,000 in the budget,
right, so we won't go
I'm
over that.
saying, we only spent 7.
I know. But he's coming to do another big pump, which is,
Yeah, He's doing 40,000
We're on
gallon
waste
pumps tomorrow.
We're on waste removal there, aren't
yeah.
That's what I'm talking about.
we?
Right.
Okay.
$7,000 is
Oh,
that
okay,
what we
okay,
spent?
to date.
Today, we have another pump coming up, which is in the third quarter. I mean, it was in the fourth quarter. All right, how about 16? It's still a $4,000 reduction, you
Yeah.
think you can get through with that?
Yes, I'd be
Okay,
happy with that, even with if the bids go up a little bit, I think we'd still be okay with that.
okay.
Gonna
So
make
it's
that
still a
16?
4,000, yeah, 16,000. Okay, go ahead, Will. 4,000 is not enough?
But you're gonna say, well,
Diesel
you
fuel.
spent less than 2,000 so far, so I already know your argument coming to
Mhm.
that, but, I guess we can try it, I just,
No, do you anticipate something different happening this year?
if we get more snow, we burn a lot of fuel, a lot of diesel in that backhoe pushing snowbanks back. We didn't, I think I pushed snowbanks back, we pushed them back maybe once last year because of a little bit of snow we had. There are years where we're pushing them back every storm, so that's where we burn a lot of diesel fuel. There is room in there, and we're gonna be spending more before the end of the year because we usually have our tanks all topped off by December. So that's just the predictability.
What would your recommendation be then?
Another 1,000 to have 5,000, just to have a cushion in there.
Willie, what happened between 2015 and this year? In 2015, diesel was about $4 a gallon. Now it's just $2, $2.10.
And
That
Well,
should
you have a
have
diesel truck? No? Oh, you don't? No.
No, just.
because all the diesel, the majority of the diesel at that point was put, that's when we had a farm and a maintenance budget. And most of the diesel was in the farm budget and most of the gas was in the maintenance budget. So when you're looking at these histories of 2015, it's not inaccurate because there was another budget that's missing.
good explanation.
Yeah,
Someone's
that-
gonna ask you that.
Right, that's an important piece.
So
Because I
let-
had the same questions, like, well, you went from 300 to 4,000, how did that happen? So,
So you want to split it with me? 4,500? That's $500 gonna be your buffer?
Okay.
What are we gonna do with that?
$4,500. 4,500.
Okay.
Next is the telephone.
You know, what happened there between 2015?
Again, the farm, the water, the farm, the sewer.
So in
4 different
2015, there
budgets.
was one phone basically that got attached to this budget, and the other, basically 4 phones were split up between the farm and the water department. Now they're all combined into
Okay.
one budget.
Okay. Be ready to be quizzed on that one.
Yep.
The travel expense. Vehicle lease purchase, so last year of the processor. I'm gonna rate last year.
Why travel expenses at $1?
Yeah.
Obviously, we're keeping it open to put money in.
Because he uses the county vehicles when he goes to travel.
You use that to
Classes.
go, you up to take the water up and,
99.9% of the time where we use the county vehicle.
okay.
But in the past, theoretically, when I had more employees, if there was a storm going on and we needed both trucks here, and the third employee was gonna go take a water sample or something and use their own vehicle, hardly ever happened, but if the circumstance came up, I wanted to be able to give them mileage. Now that we're down to 2 employees and we have 4 trucks, that's kind of, but in case something came up, I just like to leave it open. But I haven't used that in probably 7 years since we've put in for any kind of travel expense.
So the vehicle expenses, we had to transfer money into this year, right?
Correct, and that, there's still a bill coming in for $700 or $800. That's gonna be for the new set of tires that we had to put on the sanding truck.
Right.
So, but I think 2,000
Yeah,
is
because
fine.
you won't need new tires next year.
Correct.
Okay.
The processor lease, this is the last payment?
Correct,
2017, yep. Sand and salt, we've reduced it, we're not using, hopefully no sand next year. And we reduced the salt, because we're gonna try to use the brine.
Correct. I think that's gonna be, I originally put in for 12 again to match it, because I would like to build some history first, but
Mhm.
I think that's gonna be awful close if we do that, because that also has the, when we combined the budgets, that got the different stuff put in there, and so I don't know if that's gonna be close or not. And we could try the 10, or if we could meet in the middle, or just see what happens, I guess.
We used 48, but we have a bill coming up in the 4th quarter, and the salt, you're gonna buy the salt this year.
Right, that's coming, the brine's gotta come yet,
Yeah.
there's several bills that are gonna be coming in this 4th quarter.
All right, so let's put that back to 12 then. I just forgot about the, I didn't think you used, I thought you already bought the salt, but
Right,
you just moved the sand out of the barn
correct.
for the salt,
Yeah.
okay. So the chemicals,
I think we could reduce that.
okay,
I think that we could go with 1,500 on that instead of 2,000.
Can you
How
tell
much,
me
15?
why?
1,500.
I meet you in the middle, public 13.
Why is,
Why we got
See.
coal patch, parking light changes, curb markers, outside recurring repairs, lawn seed, fertilizer, snow pushers, shovels, and chemicals, when it's under the title of chemicals?
yeah,
Again, that was because last year there was a combination of what used to be in the farm and the water and the sewer and the maintenance all got pushed together, so that description all got pushed together. But,
Let's change the name of that.
well, description, the name could be chemicals, and we could reduce it to
No, I don't
1,500.
like chemicals. Let's put in,
DPW supply.
yeah,
does the chemicals relate to the water up on the mountain?
Yes. My suggestion is those things that you're listing in that description,
just move them out of there.
just move them out of there and put that under the category, because most of those things would go under like new equipment instead, and just have that just plain chemicals.
Okay. So fertilizer, snow pushers, shovels, be out of there.
Or, some of that stuff would be charged to the supplies and services line, and some would be charged to new equipment, depending on the type of
Yeah,
item that
I'm
you're.
gonna
You
take
gotta
them out.
change, you gotta look at one of them.
Yep.
So are we going with, how much money in that one?
15.
Okay.
So in the generator expense, remember we used, should we transfer, we didn't do something.
Didn't do the transfer.
We didn't do the transfer switch because of the,
Basically, the whole coolant system in the generator.
in the generator, yeah, went.
Which was a big, several $1,000s worth of stuff that had to be done just to keep the generator running, which was higher priority than the transfer switch.
This is the old generator.
The one over at the old nursing home, yes.
That's one of the emergencies we weren't gonna have.
Yeah.
That was somewhere in the $6,000 range, $5,000 to $6,000 range emergency.
It's only showing 32
It's because we split that with
with
Bob
Bob, yeah.
and the annex budget or wherever he has it.
So,
Why do we split it?
because it runs the annex as well, and it runs the sewer. It's that one generator, because it's right in the middle of those two buildings.
Yeah, I know where it is.
So it used to run the whole the old nursing home.
Correct.
Yeah.
It still does. For whatever
Yeah.
use it needs, but
So the 6,000 is for the transfer switch and repairs, and the other 6 is the annual maintenance.
correct. I think that's where you guys got the number from.
Yeah. I'm gonna put more info in there. So the building maintenance repair, it went down to 7,000? Or I did? Go ahead.
I'm not really comfortable with that.
I knew you wouldn't be.
I'd rather leave it at the 9. I know the argument at 3/4 right now, I'm down to 4. I have more things to buy in this fourth quarter for that, and primarily that line item has become, since we've consolidated budgets, water and sewer repairs. So any pumps, whether you're talking, Commissioner Babson, you're talking about signing things, any pumps, things that associated with repairs to the water and sewer departments tend to go in that one line item. And again, even if I don't spend the whole line item, it could just be a year where there's not as many repairs, and the next year there may be more. So I would be more comfortable with leaving that.
Why do we have building in there? That make it sound like we're only fixing the building.
Because back when this budget was just the maintenance budget, it made sense for that, when there was 4 different ones. I mean, you could.
Can we get rid of building, just have maintenance and repair?
Sure.
Because to me, that's a little misleading.
Yes.
Okay. So, do you think 9,000 is what you want to see in there?
That's what I would be more comfortable with.
I know what you're more comfortable with, but
Then, yes,
a lot of times, I'm just thinking 9,000 is a lot, but have you spent 3,000 in the last quarter?
Not yet, and I don't
Well,
know that
yeah.
I'm gonna do a whole 3,000. I'd have to get the prices on some of the pumps that I need to.
So why don't we split it, 8,000?
Okay. If anything major comes up,
We'll just have to move
we'll
money
figure it
around.
out, right? I mean, for example.
I'm not gonna guarantee nothing's gonna happen.
You know, example, there was a hypochlorite pump this year that normally would cost $1,500 to replace, and for less than $100, we were able to buy a rebuild kit and rebuild it.
Yeah.
But if we didn't have that ability, we would have had, that would have been a $1,500 expense. So we try to minimize them as best as possible.
Equipment repairs look good?
Kenny, I'd make that maintenance and take the slash out of it. Make it maintenance repair, and so then the next one would be equipment repair.
Okay.
The equipment repairs.
New equipment.
No.
Oh, sorry, you wanna go back up to maintenance, equipment repairs?
I was just gonna say, I think we could lower that a little bit if you would like.
Sure, what do you wanna do? 77?
I was gonna give it even a little bit.
77.95.
I was gonna give it even more. I was gonna say down to 7,000. We could give up 800. Right?
Got it, man.
Grab it.
Sounds good. So, new equipment, what's going on with that?
I don't know. I think that can be reduced because my original budget that I wanted was about 1,500 in there for various outside equipment tools such as lawnmowers, the push brooms, rakes, things that we normally repair every year.
How much you want in there?
About 1,500.
Instead of 4?
Right, unless there's something else. I mean, the next thing that I want, I put in the capital improvement plan.
Okay.
That's more of a major expense. So primarily, we just need little tools.
Oh, the thing? The skid?
Well, there's that and the tether.
Right.
We're not buying anything for the brine? Where's the brine cost? Under chemicals?
No, it's on its
Sand
own.
and salt. We should get rid of
Okay.
sand too.
All right, could just be
Okay.
salt
Give me some.
primarily.
So, we come to the last one.
So we decided 1,500 on that one, though?
Yes, sir.
Sorry.
We are being optimistic. And we put $1,400 in to purchase logs. I mean, 14,000.
I talked to Wendy last night. Wendy, not Wendy.
No, same thing.
And she said she's gonna mark 2 different areas this coming year. Gonna be doing it this winter, marking it, so it would be up for sale next year. She didn't say how much hardwood would come off it, but 2 units rather than 1. Have you talked to her about that, or know any more than that?
Well, we may have a different idea. Will was kind enough yesterday to give me a tour of everything out back. It was interesting, and thank you for that.
Welcome.
We spent about 2.5 hours out through the woods, and we went to the field that you can't access from any other way except through the woods. That
Or
was
the field way out back?
yeah,
By the pond, by the dam?
that was an adventure. And all the bamboo.
It's where the beaver dam is.
Yeah, there's a lot of bamboo in there. Apparently
You gonna harvest it
it was dumped there years ago.
for fishing poles, or what's the new thing?
Probably not. I'll probably build my sunroom out of bamboo. And there's a maple stand out there.
Correct.
And we were talking about maybe doing some type of an access road out to it. There must be, what'd you say, 1,000 taps maybe?
I think there's probably at least 1,000 out there, but need to be more of an accurate inventory, obviously.
How big are they?
Most of them
Average.
average are probably
Good.
good size.
And he said there's a whole stand of them, but there's no way to get to it because we're down a ravine and then back up the other side. But I guess we can go around by the opening at the end there.
And what are you gonna do, sell the sap?
That's what we were thinking.
Right, one of the long-term ideas that we've kicked around in the past, and I've talked with Wendy a little bit, is once you go down that wet area and as you start kind of going back up towards the hill, towards Wolfboro, there's a lot of maples in there They're not all sugar maples, some are red maples, a lot of red maples in there too. But if that was harvested to be a sugar bush, there's potential that we could harvest the sap, or we could lease it out and be another small source of revenue. There's several potential ideas, it's just something that
What's it
would,
gonna cost for a road?
I don't, we haven't done any,
But I mean,
Is it a long road? You
that
gotta-
would be a cut though, that the loggers could do a cut out there and then make the road up for us, but make it as the cut.
and I don't know if there's potential that it might be elevated enough that they can run tubing down across the wetlands to get the sap to the other side of the wetland. I don't know all these answers, but it's just a brainstorm idea that we've thought about and that I passed on to Ken yesterday while we were driving around that.
And some of the maple could be some good saw logs in there for maple. Because, I mean, can you tap red maple?
Yeah,
Yes,
yeah.
But it's got the lowest something or other.
I would,
lower sugar count.
yeah, I would consider thinning it out, but I wouldn't cut out the red maples for the sake of cutting them out.
But there's a lot of trees in the way to get to it, is my point. Like, that could be, you know, that could be a cut just for that, you know, purpose, and we could
Yeah.
sell off that wood too. I don't know, it was just interesting to see how vast this whole area is. It's really beautiful with all the small ponds and some of the old roads, and we didn't see any wildlife. I was looking for moose or something, but we didn't see any. And then we looked at another field out there too that
Yeah, we looked at a field,
hayfield.
and Commissioner Sorensen and Commissioner Babson might remember quite a few years ago, we talked about a field out back, possibly putting it into hay production. We had Mr. Blackwood here that looked at it.
Yeah.
But there's portion of that I've been keeping brush hogged over the years. And there's a few rocks out there, and it would take a couple of years to get it up and going good. But in light of the talk of possible with the solar panel and some lands coming out of hay lands, this might be an alternative if we chipped away at it ourselves, that we may be able to get it back to hay land condition to help offset the difference that we may lose with the solar panels.
So nothing is being done with that field way out there? It's
No,
just
I-
set idle?
I just brush hog it every other year or so.
Are you talking the one when you go past the pond, or were they
No, this side.
stacking the firewood?
Behind the firewood.
Yep.
If you hooked a left into the firewood
Yeah.
area and went straight back,
Down the hill?
right,
Okay.
down there.
You know, he's doing a good job of you know, keeping it, you know, cleared out. I think if we worked on it a couple of years, that would be a pretty good hay production.
Any use to that field down there that you brush hogged across from the mattress factory?
Again, that's something.
That was interesting too.
Right, this year is the first year since I've been here that I've been able to brush hog that whole thing, because usually it's a swamp
So
down
wet.
in there. But being the extra dry year, and that's something that could be considered. I think that'll take a little more work and planning in the future. I don't know if we could put some kind of fire pond down there that would catch a lot of the water that the town directs into there, and if we had a fire pond there, would that dry up the rest of it that we could put in some kind of production? I think this other one out back first is just naturally more dry, and it would be easier to convert before we converted that one. But they're both options that, you know, that we could play around with in the future in that.
I would think you'd get NCRS to take a look at both those sites and
Right.
see what they think.
Yeah.
As far as drainage.
Okay.
I guess they no longer do surface drainage. I
I
think.
don't know. I don't know much about it.
We scheduled the regional appropriations that come in November 9th, starting at 8:30. That's the same day I found out this morning that that's the resident breakfast as well. So we'll have to start our meeting at 8:30 because we've already scheduled the outside agencies. Chuck, what do you want to just go do next?
What do you got, how much time do you have?
Half hour for each group.
There shouldn't need any more than that.
Right.
Where are they in here?
They're on page 11.
Are you all set with
Go
that?
ahead.
Yeah, I guess, sure.
Okay.
Thank you, Will. Unless you have questions.
No, we was gonna ask him something.
Oh, yeah. The emergency trailers, are they locked up or are the hitches locked, do you know?
They just sitting there, could somebody back up to him and haul them on?
I don't believe so. I believe they have a lock in them.
I
I always
do.
used to, because I used to have to go to the sheriff's department. I used to put them in this parking lot in the
Yeah.
summer and switch them. And I used to have to go to the sheriff's department to get a key to unlock them to move them, so I believe they're locked.
So on your way back, can you check and just
Text you?
text me?
Sure.
Thank you.
Well, somebody ought to make a note. Are you the only one that knows that you have to go to the sheriff's department to get the key to unlock them? If you have an emergency?
I would assume so, because I think most of the agencies work through the dispatch to when they
Okay.
need them, I believe.
So, want to go to page 11, we can do the Carroll County Convention. We have,
This is the beginning of it.
This is it?
You turn the page, that's where you see the heading.
Oh, okay.
That's what happened to me too, I just figured it
Yeah,
out.
can't catch up with those headings.
you know, the headings are on the bottom of the group. Yeah. In this one, in the budget worksheets, they're on the top. So, you know, I put their meeting expense at $3,000. So far, they've only spent $1,900 this year. Last year, it was a lot bigger because we didn't know what was going to happen. 15 was huge, but it's been pretty regular. Every quarter they meet. So, I've reduced their travel, their travel expense. I thought 6,000 was way too high. 32 might be a little too low. So I might have to readjust that.
Do they have people not taking mileage?
Yes, Comeau does not take mileage. Do you know anyone else?
Oh, that's the only one.
Comeau's on
So it's not significant?
Can we ask Chuck to, or Kathy, to quickly, we have the sheet that says how many miles and how much it is, so we could get an accurate cost of what it,
It's about $700 a meeting with travel and meeting costs, isn't it? Or a little more than
yeah, it's
that?
about,
Right in there, the 700.
well, it's
$750.
a standard with a.
$25 meeting charge and the mileage is the
Whatever
same.
mileage, can we get that figure accurately, so when we tell people, like, some representatives don't believe us?
Okay. And telling it's about, all the ones I see, it's about
About $700 to $800,
yeah,
yeah.
somewhere in there. I haven't put any performance audits, because I put 2 in last year and they took them out, so I don't know if there's any real need for it at this point. But I wanted the registered deeds in the county attorney's office performance audit last year, but they took it out.
What did you want?
I wanted the county attorneys
Yeah.
and the registered deeds.
I would think it would be important to do the registry of deeds, because that's a real revenue cow for us. And, I
Well,
don't-
she has it audited. Melissa and Heath audited it this year. As you know.
Maybe we ought to do the farm and the sewer and the water.
Hmm.
Before
Well, they'd
we
have
sort
to,
of-
they'd have to do it as a DPW.
Yeah,
That might be quite costly.
I mean, that's where the questions are.
I know,
You know,
I understand.
we can't separate it out. Maybe we have to do a performance audit and get it done once and for all.
The performance audit's not gonna,
Well,
they're not
the
gonna
delegation
separate it out.
can do that on their own. They don't,
That's true,
they don't have to have us do
that's
that.
true.
They can do it anytime.
Yeah, well, certainly the delegation can, that's their tool,
Right?
you know, but, I mean, we can utilize that tool as well and make that as a suggestion. You know, me personally, but I do agree that there's some credence to what everyone said, but, you know, when I look at, you know, what costs the county the most money, I mean, it's, you know, and where we might realize the biggest gain, you know, I would say that
Nursing home.
the nursing home or the Department of Corrections, because they have, well, the nursing home, at least, it's offset by some revenue, so the nursing home costs us about $800,000 a year. So if you look at it that way, I mean, if you look at the revenue versus the expenses.
It costs us how much?
About $800,000 a year.
Oh, I thought you said 8,000 a year, I'm like, wow.
No, 800.
I mean, it's been going down, but I mean, as far as like, what's the realization of cost? I mean, there's $11 million in expense, but it's offset by, you know, $10 million or so of revenue. But
And when you look at,
But the jail cost, the jail budget's 3.
are you back? Would you grab some of your budget stuff and bring it in? Thank you.
But you know, when you look at the amount of what we spend, the jail's 3.2 million. So there's, you know, it's a big number that
Getting up there.
It's a big number that gets generated from there, so the
On the
potential
other
for
hand,
savings.
we get a lot of revenue back
Yeah.
from borders.
Well,
I don't want to
only this year.
Yeah,
I mean, it was, I
Thanks
was
for
back
that.
on the delegation, but the idea was, when we did the performance audit, that we would continue to kind of like do a rotation. Like they would do another one, and so we could get input there and be able to utilize that.
I made a suggestion last year and they said, no, we're not spending money on that. Okay.
Well, it doesn't do us any harm to put it in if they want it.
they want to take it
Will
out.
do. What do you want it in?
It's a nursing home.
Do you want the nursing home?
I think the nursing home is a good
biggest.
spot. Well, it's not necessarily the biggest of what it costs,
Well,
but it's
the
certainly,
biggest- it's
It'd
the
be the
biggest
costly
we-
one.
It's the biggest
Now, you
one we
remember
spend
what the
money on.
performance audit does. It doesn't look at money. It
No,
just
it
looks
looks
at
where you can
the
change.
systems and the
Yeah.
and the fundamentals and,
And that's what we need.
okay.
but it can also look at cost. It can look at potentials for cost savings and consolidations and things that they could be doing.
Right, but they don't take the numbers and give us a.
No, it's not like I'm Lansing heat.
You're talking about the same thing I am, system changes, potential places to change expenses.
Talking about cost, I hope that we give that farm committee all the information regarding farm expenses and farm revenue. We need to get that once and for all straightened out.
Yeah,
Personally, I don't care whether we're losing money or we're breaking even. We just need to get the correct figures. There's too much stuff going around
Caleb,
saying
would you come up to the,
that our figures are not accurate. I mean, we've got we should have the figures somewhere.
but it's, you know, to your point, and, you know, when they made a 91A request for the information, it almost gave the impression that for some reason we were withholding the information, which is clearly not anything that we've done.
no.
And I think hopefully that was resolved during the course of the delegation meeting, that certainly from the board, and as far as we know from the administration, there hasn't been any pushback. They were trying, as far as obtaining information, I think they were just,
And I met with Becky yesterday after the meeting, and the 91A went to the commissioners, and you answered it. But I don't know what the questions were, because I didn't
Did
see
you
it.
provide the information to her that she was looking for?
No,
You just answered that we had received it.
received it and that, it's a hard thing to figure to pull out of the air. It's in the public works and what's public works, what's farm.
There's gotta be a way of doing that. I mean, I talked with her too after the meeting, and she wanted to know what the insurance cost was for the wood processor. Well,
We
it's
don't-
not itemized
It's
out.
not like that.
It's
Yeah, it doesn't
under
work like that.
Under a umbrella. Yes, every year we add things to it or change things, but we don't have the cost for that, so they need to forget that
Right.
and get on with, you know, wages, the benefits, the gas, whatever it costs to process the wood, all those things. We should be able to get that. Can't we get that?
We've given them that. Anything they've asked for, we've given them.
Okay.
Which is, I think, is the
It's
point.
not
that-
an instantaneous response. It takes us a while to put the data
Yeah,
together.
I realize that.
And I said, I should be involved in those emails. I didn't know what was going on. No one ever told me that she was looking for any information. So I said, you gotta include me in the process,
Yeah.
so I know what's going on.
Yeah,
So, I think we've got it straightened out. I hope we have it straightened out, that they don't have to file a 91A request. She thought it would be better for,
Tracking.
for tracking, but, I think we answer the delegation with their questions. They don't file 91As.
I think if it
Especially a
takes,
subcommittee of the commissioners would never file a 91A request.
no,
Well, I think that was the insinuation, though, is that when Representative Comeau was like, well, why are you putting forth this 91A request? The only reasonable reason why you were doing it is because the administration was not giving you information they were asking them for. But that isn't the case.
But
She was
she
doing
said
it
was
to have
for
it be
tracking.
for tracking of how long or whatever, so, So anyway, I think, I can speak for the board to say that we are more than happy to give them all the information that they request,
That we
within
have.
that we have within reason.
and if it takes a meeting where they can come in and you people can get together with them,
I
and
suggested
go
that.
over that.
At
and
the
get
last
it
meeting, I
cleaned up.
suggested that, give us a date, Chuck and I will sit down with you, and we'll, whatever you, because they don't know how the process works. And this was 2 weeks ago, and I haven't heard from them, so.
I'll talk with Steve.
Well, they're having a meeting next Wednesday, next Thursday, November 3rd, and then the 5th, the farm walk tour. Whatever that is. So I've got Michaela here. We went over your budget briefly,
Right.
and
Is this next year's budget?
yes.
Okay.
And on page 2 for the commissioners, there's the salary part-time needs to be $32,160. Chuck, I don't know why it's $17,160. That's just the administrative cost. So somehow that extra $15,000 for the law clerk was taken out for some reason.
I didn't know that was a new position going.
Okay. So that's gonna be 32, but I'll get with you after this. Some of the questions, Michaela, was the question on spots you guys had, right?
Yeah.
Yes.
So I told them that, most of the other county attorney's offices have spot location in their office. And you have to do spots checks for,
Oh, I'm happy to talk about that. In fact, I think we're the only county attorney's office that doesn't have it. Maybe COAS doesn't, but I think that they do. Spots Terminal gives us the ability to run a criminal background check. We are required
Oh.
to give criminal background checks on the defendant, or not criminal background checks, sorry, the rap sheet. So somebody's criminal history on the defendant and any witnesses to the defense attorney so they can prepare for trial. We also, obviously, as prosecutors, when we're plea bargaining a case or we're looking at what we want to make as an offer on a case, we run the criminal history because we want to know, has this person done it before? Is this a first-time offender? Anything like that. So
How's it being done right now?
we're having it done through the sheriff's office, and it takes them, they have 3 days to get it to us. So I'll just give you scenarios that come up all the time. A defense attorney calls me up and says, hey, we got your offer of, whatever, and we want to counter with this. And our criminal record was run when we filed the case. It has now been a year. I don't have an updated criminal record because our cases have dragged, unfortunately, and I think it'll get better, but right now, we've got cases that are 1, 2, some even 3 years old, some of our cases, and we need to get updated criminal histories. So now, I have to say to the defense attorney, let me get back to you. Then we put in for an updated criminal record. We wait 3 days, then we get it, and I'm like, well, wait a minute. I don't even remember what case this goes to. Okay, now I remember, now I've gotta go back and read the notes, figure out why I needed this, because in the meantime, I've been dealing with 20 other cases. So it really becomes an issue of, I don't even need to print them out sometimes, I just need to check. We also, when we get, somebody who's on a suspended sentence or a deferred sentence, we wanna know what should happen. Do we wanna agree to convert that from a deferred sentence to a suspended sentence? Well, that depends on whether or not they've gotten in trouble since they pled guilty.
What's it cost?
The terminal used to be a lot more expensive, but we've done some checking and they're going to a web-based system, which is going to be much less expensive. And I believe they have indicated to us that the first year will be 800 and something for the license. And then after that, we just have to do a renewal for about $200. And that's the email that I received from the state person that did that.
Is there a cost per?
User?
Yeah.
Not that I'm aware of, and the training is free, it's handled by the state, and I feel like,
Looks like $800.
Did you mean
It's
user,
nothing.
Dave, or did you mean every time they seek
Oh.
information?
Yeah.
Every
we
time you
don't-
seek information, is there a charge?
no, we pay for that license and we can use that. And we used to have one, many years ago, we had one, and I guess it just seemed like it was too expensive, but we used to have a special equipment and things, and now they're going to a web-based system, and they said the state is looking to impose a license fee, but it won't be until 2017, so at least, 2019, so at least for the next 2 years, it will be a much reduced cost, and I think that it's something we can
$800
think about.
seems to be pretty reasonable.
It seems pretty reasonable to me too, and it really will help us because what it does is it means we can do that faster and we can get an answer faster and we don't have to read the case and then go back 3 days later or sometimes a week if they're very busy. We go back and read that again and catch up, so I feel like it's a good.
I really don't have any problem for $800.
No, I already.
Go ahead.
But Makila, if we do this, will that allow you to, or allow us to eliminate the money we pay for criminal checks from the state police? Could you take, if we've got an applicant for a job, could you use that machine to check the criminal background?
I believe that would be against our licensing. I mean, we have very specific licensing that we have to do. And we're still going to have some of it run outside because sometimes we need a certified record and we can't do that, so we have to request that from the state police. But I don't think that we can, we don't have a civil component in our office. And so that would be outside of our licensure agreement.
If you're gonna check jurists, I mean, what's the difference between going over and seeing if Dave Babson has a credible
We can't do
clinical
that.
record, or?
We would lose our license if we did that. We have to only use it for the purpose that we're allowed to use it for. So we can run it, what we do is we run witnesses and defendants through there. We can't run our neighbor through there. It has to be in a secured place so that you're only the people who are licensed to operate it can operate it. I have to send my people to Concord to get trained and licensed to operate it. We only have a certain number of licenses in the office. So,
And certain people can't even see it.
right,
You don't do spot checks on jurors, do you?
not that I'm aware of.
Oh, I thought that's what you told
But
me.
no,
You
sorry,
said
on
that.
witnesses,
Oh, witnesses.
yes.
The court system should take care of that, shouldn't they?
I wish I could answer that for you, but unfortunately, I don't know the answer to that. I can look that up and I can get back to you, but I don't know the answer right off the top of my head.
And unfortunately, if you're referring to the nursing home background checks,
Yeah,
it has to be done through the state police. If you notice in the certification, in the Medicare, it says, in the licensing, it says with the New Hampshire State
Certified.
Police.
Oh.
So-
Yeah, you probably need a certified one.
Yeah, he's referring to the certified, and they're like $25.
Right.
So they put their stamp on it.
Right. Okay, now, in salaries, the assistant attorneys, we have 72.5, 64, 61, and 58 is a new position.
Would be the new position, correct.
Okay.
And that 58 is for a full year?
Yeah, as I.
Because I remember we did this prior to learning that it was gonna start, and as I was down the hall, I was thinking about that, and,
It'll be less for next year.
right. So we had done this prior to and thinking that it was starting January 9th. That's why it's the full 58, but we will reduce that to the 9-month position.
What's the purpose of a law clerk,
Well, the,
half-time law clerk?
it's just a part-time position. The Public Defenders Association and most other county attorney's offices have law clerks. What you do is you get somebody who's maybe in their 3rd year of law school, and they can answer motions for you. They can do the research, the legal research on the motions and get that to you. And obviously, the attorneys have to sign off on that. But right now, we're doing our own motions. And I just tried to figure out how many hours we really have per case, and it's pretty minimal. If you take the number of cases we have, divide it by the number of attorney hours we have every year, it's pretty minimal.
And the
obviously-
paralegal can't do that?
No, not really. It really should be a law clerk, somebody who's in law school. A paralegal, I mean, she has some training, but she doesn't have 3 years of law school or 2 years of law school behind her to be able to research all of that. And I've started to utilize our paralegal to do more work for grand jury indictments and to sort of type up summaries on every case as they come in, so that's something that's going to streamline the process there. And we only have one paralegal, so I think it would be too much for her to ask her to do the motions, and I would feel more comfortable if it was somebody who was a law clerk. That's how I got started. I think that's how most attorneys get started, is you build your resume by working as a law clerk. And I know that we are at a disadvantage with the public defenders having law clerks, because their attorneys don't have to do their own research, so their law clerks can file a stack of motions that they and then we have to answer them. And so our attorneys are really very stressed with regard to the time it takes to answer those motions. So I would like to just get on balance with the public defender. I know that, for instance, in a public defender contract, they have a cap on the number of felony cases they can take. And I was wondering if they stayed within that cap, and my understanding is that they don't. They do go above the cap. But at this point, we've got Jeff who has 4 times the cap. I have 3 times the cap. I don't think that they ever get that far beyond the cap. And so really, we're sending people to court in equal positions. And I feel like the victims and the citizens should have as good a representation as the defense. We don't represent the victims, but we do have to fight for the victims, and we do have to fight for the community and to try to limit the crime in our community. And I just want to be balanced when we go to court. I don't want to feel
Is that
unbalanced.
figure correct then, 17,160?
No, it should be 30, it should be 32,160.
For
Because
which
you gotta
one?
add, you gotta add the 15,000 to the 17,160.
Is that part-time, on the part-time salary?
Yes.
Okay.
We did the 15.
It's part-time now, and that's the one that's shared with victim witness, right?
Yes.
Yes. Why is it that you, for the criminal case expense, in 15 you had 4856, and you weren't here, but this year you only have 1617 so far.
Which line item is that? I'm sorry.
I'm sorry, it's 028.
You're saying how much we've expended?
Yeah, you only spent $1,600.
Well, I was actually going over that yesterday, and we are not trying as many cases. A
Okay.
lot of the criminal case expense, it goes into experts and things like that, and when we're not
So
trying.
that makes sense.
But I would like to try more cases. Let me be clear, the reason we're not trying as many cases, in my understanding and from what I've seen in the last 3 months, is because there's just not enough time to try cases. Trying a case takes a lot of prep time, and we just haven't, I don't think we've had more than 3 this year. We
You don't
just
have the
haven't.
staff.
We just don't have the staff to do trials, and that's unfortunate, because we should be trying cases. I've got several set in December, so I'm hoping we'll get a few of those done this year.
Okay.
We've only done 3 trials this year.
I can get you the number. We've done 3 since I've been here, and there may have been one that Joe did earlier in the year, but I'm not sure if he did that last year or this year. So we just have not done a lot of trials, and I know when I was here in 2014, I was here for 6 months, and I think between Brandon and I, we tried 6 cases just in those few months. So we were trying about 1 a month, and I think we should be trying 1 to 2 every month, and we're just not able to at this point. So we need to make sure that we're getting fully staffed so that we have the ability to do that.
Doesn't that weaken our position if,
I would think so.
if the defendant knows that, well, they can only do 2 or 3 or 4 trials this year, we'll go in and give them even a more ridiculous counteroffer to their.
Well, we are seeing that, and we're trying to strengthen that. Jeff has done a couple of trials. He's done 2 in the last 3 months, I know, and maybe 3. And you know, he's doing a good job. Kim's just started, and I've got a couple set, so I'm hoping to change that perception. But again, it's difficult to do when you're short-staffed, because you're doing your own motions, you're writing your own motions. A lot of those cases, we've got a few aggravated DUI cases with serious injury. You know, I think we have a negligent homicide case over there right now pending. We've got a lot of serious cases, and they're very motion heavy. And we've got, for instance, grand jury subpoenas that we have to do, and trying to get records for things. There's a lot of work to do on those types of cases, and we don't have any help to do those. So our attorneys are having to do all of that prep work themselves and all of the motion practice themselves. And so I'd like to get us, you know, staffed at least as good as Belknap is, so that we can be competitive and mean what we say when we make an offer.
If we only had 3 or 4 trials this year, where does all this work for the victim witness person come from?
Well, we do a lot of things. She coordinates grand jury, so we have to get witnesses there for grand jury. We do have to,
That's for what, for every case, every arrest has a grand jury?
No, every month you have a grand jury.
We have grand jury every month.
No, but I'm asking, my question is, does every arrest have a grand jury?
Every case, we have to do a grand jury indictment for, yes.
Okay.
So we do grand jury indictments for everything, that's how we file cases. They have to go in front of the grand jury, and we need witnesses for that. We also are statutorily obligated to notify victims of plea bargains, so she has to reach out to the victims, get them in. I mean, obviously, on a case dealing with small children who have been, for instance, sexually assaulted, those require a lot of work. We have to talk to the parents, we have to explain the process to them, what they're going to expect. In the criminal justice system, we have to explain every offer that we make, every counteroffer, every offer again. An attorney, if you're planning on going to trial on a case like that, you have to meet with those victims multiple times. You have to take them over to the court, show them the courtroom, tell them what to expect, kind of work through what they're going to be looking at. Every time a case gets continued, you have to meet with that victim again, because this is the most important thing that has happened to this person in their entire life. And it's frustrating when those cases get bumped out for years, and there's a lot of work to do with those victims to help them understand why this case has been continued, what's happening, what motions. We also have witnesses on evidentiary hearings that come forward for if somebody's been, for instance, arrested while they're on probation, we have to do an evidentiary hearing, we need to bring witnesses in for that. So she's coordinating all of that. It's a lot of work for one person.
So the victim witness workload really isn't attached to the number of trials.
No, it's attached to
You
everything.
can be a victim or a witness and not go to trial.
Right.
Right.
And but we still have statutory obligations to notify them and to talk with them through it. And sometimes when a case is, you know, say we have a really serious sexual assault or a domestic violence case where somebody was really seriously injured, and that case is going to get resolved, and there may be problems with the case. any number of things. Maybe something got suppressed at an evidentiary hearing. Again, we need the witnesses to come to that hearing, and maybe the judge says, well, you're not gonna be able to get this evidence in. It weakens our case, which weakens our position on plea negotiations. So those are conversations we have to have with victims, and those are tough conversations, but she has to do that.
Well, let me ask a different type of question. When you become the county attorney, what is going to be your philosophy about helping out the county in other matters other than going to court, like reviewing contracts and so forth?
You know, that's a question that I have raised because I had never worked in a county attorney's office that didn't have a civil unit as well. It would require a little bit of research with regard to malpractice insurance. I don't know whether that would be then required if we're doing civil work as well as criminal. Criminal prosecutors, we have immunity, so I don't know the answer to that. I was never in charge of a civil unit, but we always had a civil unit that protected the county and that stood in for employment actions and things like that. I'm happy to do that research because I do think it makes sense to have that. I know I want to say it's Hillsborough that has a civil
Yes, it
unit. Is it Hillsborough? I don't think any other county attorney's office has it, but in my mind, it makes sense to have that work done in-house. I think it's less expensive for the county, although, we're a small county. I can't imagine we would need more than a half-time person to do that type of work. But I would love to see that happen if that's something that the commission wants me to look into. I'm
But right
happy to
now,
look
we're
into
going
it.
outside to get any
Right.
opinions.
Right, and we're fortunate enough that we have someone already next door who's worked in municipal law and has that experience, and I'm happy to do that research if you want me to. Would you like me to look into that?
Well, I think it's,
When you become the county attorney,
yeah,
Okay. Well, I could do the research now to tell you what
Okay.
it would take. and
we don't
whether it's
want to
feasible.
take any of your time away from prosecuting.
I know Hillsborough, they don't work in the county attorney's office, they're
Okay.
separate.
They're separate?
Yeah, and I talked to her, she's very nice, I've used her. So she's very nice, you should reach out to her, I forget her name, but.
That was gonna be my first, because she would know about New Hampshire.
Yes.
So that was gonna be my first call, but I'm happy to do that and let the
Okay.
commission know.
Are we all set with the budget?
I'd like to move over to the medical referee, and that's $41.50.
What page?
Oh, I'm sorry, page 6. Now, we had a line item transfer this year because we're having a lot, of the phone consults. So far, we've used 1,025, the budget was 1,750. And after this was printed, we've since gotten more, and you guys see them every week, so we were able to just transfer some money from the physician services. But it looks pretty flat in most areas. Transports, we did put a little more money into that as well, because we're getting more of those. Now, the transports are when someone,
When they pass, and when they have to be transferred or transported for autopsy, things like that. And I think that in the past, we have,
have to.
right, and now we have to pay for some of those.
Yeah.
So that's why that has gone up.
Is up a little higher up. But for the most part, everything's stayed the same. We've reduced the physician services down a little bit, but not a lot. I mean, you never know, especially with the way, the fentanyl and the heroin crisis is going. We're having a lot more overdoses.
Right.
Overdoses.
Is the physician services, is that the one that, he obviously or she pronounces the person dead?
That medical examiner, is that Ken, I'm sorry, you would know that better than I, is that the,
Yes.
okay. So that's the medical
Medical
examiner. They
referee.
waive off sometimes and they.
Wait a minute, is there another
No, it's the medical referee.
medical referee? Okay, physician services?
Yep.
We're paying, is it $40 a call to tell the doctor they're dead? I mean, the charges.
It is high.
This charges in this,
Are you saying $40 just to say that they're dead? Well, but that's not all that they do. They have to decide whether or not they're going to do an autopsy, and so they really need to get all of the facts. I mean, it's not like it's a 2-minute phone call, it's a determination of whether or not they're going to respond to the scene to take a look. We have to determine if there's a suspicion of foul play, if this is just an old person who's had a heart condition and this is consistent with that and we don't need to do an autopsy. So I think that there is a medical opinion that goes into that, and I think that's what we're
let
paying
me ask
for.
you this question. Is there a lot of suspicious deaths in the hospital? When it says dies of natural causes, and then you get to pay for this phone call for the doctor to say, yeah, the person can't pick the phone up and talk to me, he's dead.
Well, I don't think I understand what your question is, but I don't think it's.
This
as
is a
simple as
really,
that.
it isn't a lot of money, but it's a real,
It's a pass down.
they
Really?
take advantage of us.
But, well, I don't know about that, and I don't have enough information to answer that question, but I do know that sometimes it appears that it's not suspicious, but later it becomes suspicious. So I know that we've had that issue just recently since I've been here where there was an issue that it looked fine, but then once further information came out, they decided that it did need to be investigated. And so they need that information, and we would be remiss if we didn't get them that information and then find out later, oh, this was a homicide made to look like a suicide or something, because those things happen. And so really they need to be able to take that time to speak with the people that were there and get as much information as they can before they make that judgment. And they should be compensated for that. I mean, I don't know enough to tell you that they're not doing that. As far as I know, they are. When I get the calls, they go through and tell me what they've talked to the medical examiner about and what the medical examiner's opinion is. I don't think they're just simply making a call about is the person dead or not.
When we get our next bill, if you don't mind, I'll bring it up and you can sit down and explain it to me. Why natural causes costs, I don't know how much money to get the okay from the
They
doctor.
still have to read it, and they still have to understand, because the natural causes, I mean, they still have to talk and make sure that
I'll bring
that's
one up.
natural. I'm happy to talk that through with you.
Okay, other than that was it for the budget for today, right, Chuck?
No, we didn't finish on the county convention, because, look.
Yeah, we did.
No, we didn't. I didn't finish.
What is it else wanted?
Thank you. You might
Thank
have.
you, thanks for having me.
Thanks, Michaela.
Thank you, Michaela.
And that's on page 12.
Yeah, do that. The publications and documents and dues is $250 enough? We have,
I reduced it to 100.
excuse me, well, okay, that's even more pertinent. Delegation members are coming in and using the copier. They're I don't know what the dues are, but it's
That's
$100.
under office supplies,
Huh?
by the way. Office supplies is all their copies that they get,
Okay.
all the reports, stuff like that.
Um,
I don't,
Is $750 enough for advertising?
well, we only used $286 this year, and $625 the year before. I don't know why, it was bumped up to
I
$1325.
tell you, Ken, I have a hard time with 286. We have, every time they have a meeting, they post it in the paper, and they're averaging $50 or $60 a whack, and we've had a lot more than 4 or 5 of them.
3 meetings, that's all they've had this year.
But every time we pay for when they put like the farm committee,
That's not in the
I don't know.
paper.
It isn't in the paper?
Not, no, not
Has
that.
Where- where
has
are the
to
other
be posted, but
It's posted on our
Okay.
website, yeah.
Okay. Travel expenses. Oh, that's the one.
would you say the subcommittee last night was posted?
Yes,
They-
it was.
Yeah,
They did?
yep.
I just did, we said, it was roughly $700 a meeting for travel, for mileage.
Yeah, so they've had 3 meetings, so we're at $22.91. 7, 14, 21, $2,200 roughly.
How about all the subcommittees? I mean, nothing happens after March. They have quite
No, what happens after March?
Some of them take mileage as subcommittees and
And
some
some don't.
don't.
Only one that doesn't
No.
take, subcommittees.
Yes, that's what
Okay.
you said, subcommittee, so we need to do orange, apples and apples, not oranges and apples.
So,
But they,
okay.
I don't know, I guess I'm not following through, and it may not be necessary, but I mean, certainly they've had more than 3 meetings this year if we count the budget process.
Yeah, that's what I'm saying, Chris.
But they all don't meet together. And some, again, put in for mileage, and some don't during the subcommittees.
No, but full delegation meetings, there must have been,
3,
They're supposed to meet quarterly.
right? So as of 9:30, we've had 2
No.
quarterlies.
They had at least 2 meetings in January this year.
Listen to me,
Yeah.
okay? They've had 2 quarterly meetings since 9:30.
Right.
They had the March and the June, yeah, and the June quarterly meeting. Then they had 2 meetings in March, in March, for the budget process, that's 4 meetings.
And we didn't have one August 25th?
That was the,
That's when
that
you
was the
included
second
account.
quarter.
Okay.
Yep. So that's what we've paid out so far this year. I don't know what else to tell you, that's what we
Okay.
paid out, as of 9:30. So that's 4 meetings.
Okay.
I'm just sorry, I said 3 wasn't enough, because I could think of 3 just off the top of my head quickly. Okay.
And again, some people don't take mileage, some do, but that's what we paid out.
All right, we all done with that one?
Yep. So I'm all done with the budget
Was,
Well, where?
for today.
For today. So will we be soon seeing the revenue side of it?
We'll be seeing that on the 16th of November.
But this, on page 17, this total expenditures is all the funds, totally?
Yeah, but that's gonna get changed.
Right, I understand that's gonna need to be adjusted,
Yep.
but I'm just, because there's some things that aren't in there, but
Right, there's all the medical, all the dental is not in there. And that's a few $1 million.
so there's. All right, well, I mean, it'd be, so by the 16th, you were gonna be able to,
We'll be done expenditures by then, and we'll be working on the revenue. Because we just did 2, 4, 6, 7 budgets today. And we got sheriff, registered deeds, dispatch, and the jail coming on the 2nd. And then we'll have everyone else on the 16th. And then we can jump in the revenues. They still don't have the nursing home revenues. I should have those next week.
All right, so by the 16th though, we should have, the budget should be put together in its totality. I mean, obviously there's gonna be the minor changes
Right,
that we
but-
make, but as far as being able to see what the proposed,
So by the week of November 22nd, you'll have it ready, should have it ready to go by then, right? I mean, you may have to have another meeting in between those other Wednesday meetings, but like we did last year.
Okay, let's,
I'm just trying to get an
we all done with
idea
the
of
budget?
what.
For today?
I think we're done for today,
Yeah.
but my question is, I'm trying to get an idea of what our draft amount of
Increase?
revenue to be derived from taxes.
We won't know that till the middle of November. Till we get all the revenue numbers.
Right, no, I understand that, I mean, because that's part of it, I'm just trying to, because it's, in a sense, it's like, when you're looking at things, or you're looking at the expenses, I mean, to have an idea of what we're looking at for the total increase and the total cost is also
I'm
part,
looking at the same as last year. I don't see any huge increases. I don't see it going up at all.
Okay, but because I think from the board's point of view is that, there should be some direction in the fact that we only want to have an increase of, 3% or something like that.
That'd be great.
That's what our
Do the 3%.
our expectation is that when this gets put together, that what you're gonna present to us is gonna only have that sort of increase in it.
Again, I don't think you're going to see an increase, but
Okay, well, that's good, that's good news. That's good news, it's just,
I don't-
We're going through the book without knowing the ending, but the ending is the most important part of the book, I think.
I don't want to spoil the ending for you. All right, so don't go to the back of the book and read it.
Well, I was though, I
I
was
know,
trying to figure
so
it out.
it's not gonna tell
I
you.
realized I didn't have the revenues, so.
What do you say we move on?
Yeah, I'd love to.
Survey?
In your packet is a copy of the survey that I sent to the nursing home a couple weeks ago. And as of today, I have 77 out of 185 surveys submitted. There were 7 questions. There were 6 questions in a comment and suggestion area. I've had requests from some employees that I wait until Friday to pick them up because they want to still submit some more. So I'm not looking at any certain date to be done. I want to get, it's right here. I'm going to give the employees as much time as they need to give me some good input. And so far, we've gotten a lot of good input. I've read every one of them. Commissioner Babson has read every one of them that's come in. And there's some really good things to look at. There are suggestions that, what I'm going to do with these. I'm gonna read them. I'm gonna read every one of them, which I've done. I'm gonna put them into different categories. Then I'm gonna submit them to all of you to read, and then we can see what the employee is looking at, from their point of view.
Kenny, what kind of categories are you gonna put them in? You guys haven't read them yet, and correct me if I'm wrong, Ken. It appears to me that you either have people there that really like working at the nursing home and have scored the sheet that way, or that they don't like working there and you're wondering why they're still there. And then there's a few in the middle. So how are you gonna break this up into a survey?
A meaningful.
I'm gonna look at every question and, do what they've circled as a summary. Say, 10 circled 5, 20 circled 3,
Okay.
50 circled 1, that the staffing ratio at NBC is inadequate. Then you can look at it and, aggregately and go, wow, okay, most out of the 185, 75 of them said that it's staffed inadequately. So, then you really gotta look at that and say, geez, that's not what we're being told, but You know, so at least we'll be able to look at certain areas, of the nursing home that we have questions about, and we may be looking at it a certain way, but we need to look at it from the employee's point of view as well, because they do all the work there every day. So I think it'll be interesting to review the whole, spreadsheet.
I think that's a good way to do it, except with one little caveat. What happens, for instance, question number 1, there is an awful lot of the answers come back. The staffing ratio is somewhat better or exceeds other facilities, and then they put in when there is no call-outs.
Well,
And that's
and that'll be, a weighted average.
so what are you gonna do, put that under a comment column?
Yeah, because why, if 60% are seeing that, so why are staff calling out? That's another question. Why are so many staff calling out? And to look at that
These are really
question,
enlightening when you sit down and read them.
because on number 5, how successful have you been in being able to receive requested time off? So you would think that people are saying, oh, we never got our vacation, but most people think that, I almost always receive the requested time off. But again,
Just
it's,
to guess, I would say number 3 was probably the average answer. I get my fair share of requested time off.
yeah, and again, you have to look at how many years they've been there, if they're new, so. And we give this to everyone, even to all the per diem. So anyone who works and gets a paycheck got one of these surveys. We've had 2 that have given me their names,
I was
which
gonna
is
say
interesting.
one, there's only 2.
Yeah, 2 people have given me their names. I
Some
can
of-
tell by
some
some of the
have written a
answers. Huh?
Some have written a book.
Some have written books, really, like 3 or 4 pages of your comments. Yeah, I'm telling you, so I don't want to really cut this off at any, when I start not getting some for like 4 or 5 days, then I'll just start, adding them up and starting to put them into some sort of a process. And but if, there may be a couple ones that will come in late, I'll just add them as I see, but.
I like the
I
idea
think
though
getting-
about what you talked about, if we saw the disbursement of
Yeah.
answers and then as well as the average answer.
Yeah.
Like you said, so there's so many 5s, there were so many 4s, there's so many, and see that and then saying the overall was 2.84, something like that. That's because seeing how the array of answer can also give some indication.
Yeah.
So I think that's.
And you can even chart it too, on a line graph.
And then perhaps perhaps we'll see from the comments, some further questions for a survey sometime in the future, maybe in 6 months or so. If
This may not be the only survey.
Right, like, wow, a lot of people have commented about this, well, maybe we need to find out more about it.
And this came about, I have to give someone credit for this. An employee came to me with concerns over some issues that have been spread around through the campus. The person made an appointment, came in to see me, and we talked about all of this. And it was her idea to come up with the survey. And I'd like to give her all the credit, but I don't want to name her. So, but she works in a nursing home, I had a wonderful conversation with her. There was no pointing fingers at anybody, but just what she thought, in her mind, what she saw as, as being working in the nursing
Or what she
department.
thinks we're hearing, that may not be everything that.
That may not be what we really should be looking at, yes.
I think it's important that as a result of the survey, that some kind of action, if it's necessary, be taken, and that it be publicized that something was done as a result of the survey.
And this is why we're here, is to, to find out what's really going on. I mean, we rely on our department has to let us know what's going on. But again, that may not be,
What's really going on?
well, it may not be what's really going on. So, it's really been enlightening for me to read some of these comments. They're really good comments, and Some have really good suggestions too, but others are just,
It's okay.
disgruntled employees, but that's, that's what they feel right now, and maybe they're, and maybe that's the, and then maybe, maybe it's,
You can do something to make them less
help that, right. So, we are gonna do something with these, we're not, I'm not gonna, stop my wood stove with them.
Right.
We are gonna use them,
That's great.
and,
Okay, let's
Well,
move on.
thank you though, as well. I mean, you gave credit to the person who helped give you the idea, but,
and, I had helped putting all these questions together, from management, so it's been a good time. Yellow folder. Oh, who did it?
Nobody initialed it. David, I think, Sorensen.
Would you initial, just when you signed last week, can you just initial that, right there? I have a yellow folder of non-public minutes from October 12th.
Why do you want me to initial that?
Because that's what they want, I don't know.
It was supposed to be initials at the same time you signed it.
Oh,
It just got missed.
thank you.
Well, after you guys see this, I'll make the motions, or you can make them.
do you want me to make the motion, or you're gonna make the motion about?
You go ahead, I'll second it.
Okay. So I'd like to make the motion that the non-public minutes from October 12th, 2016 be approved and remain sealed. I don't have a session number on here. There's more than one session from the 12th?
Yeah, you have a
We
number.
got three,
3,
Yeah.
session 3.
That one says session 3.
and one of them was,
None.
No,
Not
no,
meeting.
that was one.
so,
That's
That's
one
session
he's
one,
got
yeah.
two, and the other one was the
From-
non-minutes.
All right, so the non-public minutes from session 1 of October 12th
I'll
to
second
be
it.
approved and remain sealed.
I'll second it.
All those in support of the motion say aye.
Aye.
Aye. So you can sign that one. Okay, so I'd like to make a motion to approve the non-public minutes of October 12th, 2016 of session 3.
Second.
And to be remain sealed.
Second.
All those in support of the motion say aye.
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 You have my pen back?
Sorry.
And then the other one's a non-meeting, right? So just,
Updates? On Monday,
Excuse me, Ken, didn't we start a procedure here a while back, even if we weren't going to take any minutes, we were gonna have something in here that
To
no
show
minutes,
that-
just to show that we were,
We discussed the issue.
that we discussed the issue?
I will print one up for you, you can sign it next week,
okay.
so we have it for the record. It just says that it was a non-meeting.
So,
oh, okay.
Yeah.
because when we had to go back
So
for
this-
Representative Comeau
It's sealed.
a bunch of years ago, part of the problem was if there were non-meeting, we couldn't tell because there was
Okay.
no minutes. Go ahead.
So on Monday, after the delegation meeting, I had my line item transferred. They approved all of them except for the last one, and that was to add the position to the county attorney's office for 6 weeks early. So that one did not go, so. There was a suggestion
Is that the one that's not gonna start till 3 months after,
no,
90 days? No,
this was the one to replace Michaela, when she
okay,
moves up to county attorney.
okay.
We wanted to bring that person on early
So it's
to
gonna
to
start
help.
in January anyway?
Right, so it's gonna happen in January anyways, but.
Okay.
But they did want me to consider a part-time temporary attorney. I said, forget it, we can't find a part-time temporary attorney for 3
For that
months.
slot?
Yeah. That's why I think it was all about the benefits, because that was the question, the benefits. And if we're gonna hire the person, we're gonna hire him 3 months early, not for 3 months and then hire somebody else. So I just
Nixed it.
I just dismissed it.
Oh, man.
and left.
That just seems,
I didn't get it. I was trying, and we spent 20 minutes on it, talking about it, because they couldn't understand that it was just replacing Michaela. I wasn't adding any new personnel.
Kenny went here and did a artistic presentation of how the system was gonna work, and they still didn't get it, I don't think.
After our meeting last week, I got an email from Whitehorse, Addiction Center on touring the annex. So that was your suggestion, and they're gonna take us up on it.
That wasn't your idea?
No, that was your idea.
Okay.
I'm gonna give that one to you. So, I'm gonna
For
set some-
housing?
yeah, to do like a rehab center or something, which would work great for our jail.
that'd be amazing.
I mean, that would be awesome. And there's a full kitchen now. So I don't know. So they're gonna get with me next week to find out when's a good time to come, and come and take a tour.
Great. That's great news.
That's it for the updates. The commissioner's updates, ambulance and school contract for Hales. We wanted to talk about that 2 weeks ago, but
Yep.
every time we just haven't had time.
I don't think that, we came with a final proposal, and as you remember, Kennett on the final I keep calling Kennett, but that's the school
Yeah.
district, wanted us to agree to pay a,
2,000,
Maintenance?
$2,000 maintenance.
Are
it
you,
wasn't a month, or a minimum, if there were no students, it was a minimum.
No students, it was $2,000.
2,000, I remember a million, but maybe it was 2,000, 2 million. I mean,
2
2,000.
million.
2,000. And we never moved forward with it.
so. Say that again, they want $2,000
In
to
this-
keep the proposal open for.
Even if you didn't have any
students?
students going there, you still have to pay $2,000 a year just to,
For the length of the agreement.
yeah. And I think it was Mark Hounslow said that was in most
Yeah.
contracts.
And he thought it was very fair. While they're charging us 37 or
Yeah,
35 or $37,000 for an elementary school kid to go there.
And you've never addressed it since then. Now, the ambulance bid is going out. I got a call from, did you talk to them? I got a call from the ambulance company.
Somebody by the name of Mitch came in here and,
Mitch came in, that's right.
and
Yep. He's with, Damon?
yeah, Damon.
Eric Damon?
Care Plus,
Care
Care,
Plus, yeah.
or We Care, or whatever the name of the company.
So I sent him the cancellation letter saying that, he needs to rebid it. It ends the end of December 31st is the end.
And how I got, discussing, he came in, he was talking to Cheryl, and I asked him who he was, and he said, I said, well, come on and sit down and talk for a couple of minutes. And I asked him, are there other ways to bid this contract instead of just a lump sum of X dollars for the year, can we ask you for a proposal on per trip or by the mile? I mean, what are our options? And he gave me several, and so I don't know whether it's our job to figure out how we want to go about it or what.
We could do it like an RFP instead of just have a request for proposal. How do you want to do it? How do you want to propose to us ambulance service?
I mean,
Because I have the contract here. They haven't gone up in their price since,
5 years.
yeah,
And it's
well, not 8 years.
due coming up in December?
December 31st is when it
How
expires.
long are those contracts?
5 years.
5 years?
But it's been going on since 90.
I said, how about if you hold the price for another 3 years? And he said, well, that'd be my boss.
Since 1990.
I'd like to know how many runs they have in there.
I don't think they've worn out an ambulance.
Huh.
I don't remember him saying 1990, Ken, but it was
It's
quite.
right here. I have the agreement right here in front of me.
Is that the latest?
The parties further agreeing that the provisions on the original agreement dated June 30th, 1990,
Okay.
and the amendment to the agreement dated October 9th, 1990, and the second amendment to the agreement in 91, third amendment in 93, fourth amendment in 93, fifth amendment in 94, sixth, seventh, eighth, ninth, goes up to the eighth amendment in 97. For calendar year 2008 through 2012, it remained the same. It actually went down from 07 to 08, it went down $977. And it's been that price ever since.
So what's the action we need to take on it?
I want to know if you want to do an RFP or just go with what we've been doing.
I think there's no harm in finding what we can, if we can make a saving.
You want an RFP?
Yeah.
Is that what you want?
No.
Yeah. Okay, yep. Agree?
Agreed.
And that gives anybody that wants to quote on that or make a proposal a chance to do it, not just Care Plus. Care Plus has done a very good job.
Okay, what's next?
We've got, unless you have any more updates, I've got one non-public and one non-meeting.
Okay, where are we on the we don't want to call it a special audit, what do we call it?
We brought it up at the executive committee level on Monday. Chairwoman Umberger said, yeah, go ahead with it. Do whatever you want. And then Representative Cordelli said he's going to fight it on the transfer of the money. So we're going to not do anything until we can get assurance that we can spend the money, because we're not going to incur any debt.
Yeah, that's what we did.
And not be able to spend the money. So there's a little confusion on the executive committee.
Should we request a transfer?
I have to request a transfer, so I guess we can get it in November.
You didn't put it, one of those pieces of paper or one
I didn't
through
put it in,
18?
no, I didn't put it in this week because we didn't get it to you because we didn't know what we were gonna do.
Well, I think that would be our first step to see
Yeah.
if they're going to.
Yeah, I do have another transfer for the sheriff's department, so I'll put this one on as well.
Are they going to they must be going to the full delegation for final approval of these transfers,
They
right?
didn't this meeting,
Well, they held it after the meeting, so they
but
couldn't.
no, I had transfers in August. No, I had
You
transfers in
said this,
September.
you said this meeting.
I had transfers in August and September, and they didn't bring it
And
forward.
they didn't bring it up.
They didn't bring it up.
So I think that if we're gonna go up for this audit and the the 5 people that are on the committee vote yes or no, let's say they vote yes, I assume that if I were sitting there as a representative, I'd be screaming like hell if I didn't get a chance to vote. So I think they have to go to the whole delegation to get the approval. And what happens if they say yes at the executive level and then say no at the delegation?
Where would we transfer $20,000 from?
It's 139.
Oh, yeah,
That would have
that's
to be
right.
a whole delegation approval.
That's right.
That's right, that's what I'm saying. So we don't want to get in a situation that we think we have the money and we don't. We have to wait till a full delegation, or I would think we'd wait till a full delegation gave us approval.
If we want to use that money, yeah, we do.
Or we, well, can we cobble together the 20 grand and just put it through?
I'll look somewhere. Yeah,
And maybe, I mean, just to notify them that, I mean, we
maybe
want
5
this.
here, 5 there, 5 there, but I can,
Yeah.
I can cobble it.
But still,
Somebody's gonna lose out.
if we do that and we tell them to go ahead and then they get to whenever they're gonna hold the next meeting and say, no, we won't, don't.
It's not up to us, that's up, we have a process in place and that's their problem, not ours.
Well, I mean, I think there would be some value. I mean, if we're gonna go that route of just transferring some money so we can get this done, I know it's my personal feeling, I get a sense from the board that this has been going on long enough, we want to get it going.
Yep.
You know?
Because we're gonna be coming up to the end of the year and that's audit time and
Right.
we'll never get it done.
So, I mean, if the quickest way of us getting this executed is to cobble together the money, put together the transfer, have us sign it off and send it over to them to get approved at their earliest convenience so we can schedule the time, or maybe we can schedule it, but they, you know, before they come in, they have it approved. Then, you know.
However you guys want me to do it, I'll do it.
The other avenue is to take, I'm sorry.
Go ahead.
But then the other option, I believe, as we discussed, was if we take it from the 139 that was encumbered
Right.
and designated for that, how would that money, how would we access the money? That would take the whole delegation.
That'd take the whole delegation approval to because they've only voted for a forensic audit. It needs to be changed to any audit.
Well,
Or our special audit, whatever you want to call it.
Don't-
Agreed upon procedures.
Don't forget, we've got, the committee is made up of 5 people. One of them has said already that he won't settle for anything but a forensic audit. One of them has said, when you brought up money, that he'll fight it all the way. It only takes another one, and it seems to me the other one might be the gentleman from
Don't
south.
say it, don't say it.
So we may not get the approval to cobble together $20,000.
We may not, but it seems to be the
tried.
fastest. Yeah, we tried. It seems to be the fastest way to get money appropriated so that we can execute this invest and get it done.
Yeah,
And I want to get it done.
I do too.
You know, I mean, we're not here for that much longer. I want to get it done.
And it's not gonna be done by the time,
Well,
January
according to,
first.
no, it might be, according to Chuck, that they
Really?
said they'd have it done within 6 weeks as long
Yeah.
as we gave them the approval. So that's why I'm urging that
It'll be
we.
close, but
So why don't we try to
Thanksgiving
cobble
and
this
Christmas
together
holidays.
and you write Humberger and say we need, here are the transfers, we need an answer right away.
As soon as they can.
as soon
Because
as
we'd like to get it going, so it's done.
okay.
We'd like to move forward.
I mean, because the next delegation meeting's in December.
Right.
Mhm.
We don't want to pay overtime.
Right, we don't want to come in special for that. That'll make them feel a little surly anyway, but.
Okay, that's it.
Okay, do we have anything to be, public input? Anybody? No public input? Okay.
I'll make a motion that we go into non-public session. Session 1, 91A3, paragraph 2C, matters as which discussed in public would likely affect adversely the reputation of any person other than a member of the body or the agency itself. And session 2, 91A2, 3, parentheses, A, non-meeting, concerning union negotiations.
Roll call?
Roll call.
Commissioner Ahlgren,
Yes.
Commissioner Sorensen,
Yes,
Commissioner Babson.
Yes.
we stand in,
Well, wait a minute, David, one thing, if John's gonna leave, is there anything on the upcoming events that we should say in public so that people would know? We got the subcommittee, farm subcommittee, go ahead, in November.
We have the Farm Subcommittee on November 3rd at 8 a.m. November 5th is the farm tour. The public is invited to this. It'll be here Saturday, November 5th at 10 a.m.
where are they meeting?
They're meeting down at the farm building. November 8th is Election Day. November 9th is the resident breakfast. And the Board of Commissioner meeting will start at 8:30, not 9 o'clock, at 8:30. November 11th is Veterans Day, it'll be a closed Friday. November 15th, the Commissioners meeting will be meeting on Tuesday, November 15th at 8:30. November 16th and 17th, New Hampshire Municipal Association. November 24th, Thanksgiving, and that's it.
So the 15th is of note because it's a Tuesday instead of a Wednesday?
Yes.
Yeah.
Not the time.
Okay, the vote was taken, so we are now in non-public. We'll recess.
And we're not coming back.
We're not coming back for any further business.